We do have a quorum. Jonathan Anna is not here, but he's on his way. Okay. We have Legislator DeVito, Legislator Petcher, Legislator Strong, along with myself. Before we go to approve the minutes, I'd like to open the meeting with the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So let's move right into approving our minutes of the October 2nd meeting.
I'll move it.
Thank you. And a second?
Second.
Any questions or discussion? All in favor?
Aye.
Passes. Thank you. We have no appointments to discuss. We have two presentations tonight. I want to thank Christopher Travisani for coming from Housing Visions. We communicated via digitally, made it work. So we were looking for an update on the status of the shelter and particularly the ARPA. Hey, so there's a podium if you prefer to stand at a podium, or you can come sit with us.
Come sit with you or?
Sure.
Here.
Come right on up. Yeah. Hi, Jonathan.
Yes, I can give you kind of a brief snapshot of where we are right now on the shelter development. So as you may know, we did receive a site plan approval from the city of Auburn Planning Board in July. It was July 2nd. On the 29th, there was an Article 78 appeal. That Article 78 is proceeding through the courts right now. And we see some type of resolution, maybe sometime before the end of the year. There's certain timeframes, but I think there's some latitude for how the judge can respond. But basically, all the written arguments were due. They're in, and then we're just waiting for the judge to kind of provide an opinion. But that really doesn't alter our schedule at all, because the funds that we're applying for this development are through HHAP, and we're waiting for that next request for proposal to come out, and that typically comes out in spring. So we fully anticipate we'll be ready to apply for those funds in the spring, and then once the award, we'll plan on preparing construction drawings and try to start construction either the end of next year or spring of the year after.
Okay.
I don't see any concern on spending those ARPA or committing the ARPA by the timeframe.
Right. So the commitment has already been met in terms of the end of 2024. Use is end of 2026. So what have been the draws so far, and for what purposes toward the building?
So I believe we've drawn up to 300,000, I think is the number. And primarily those were for the architecture drawings. The back and forth with the planning board, there was a lot of initial designs and redesigns, and then kind of attorneys and seeker documents to due diligence to get us through that site plan.
And these ARPA funds continue to help you as a match with that?
Correct.
With the HHT?
HHAP application will be scored higher because of leverage of other funds.
Mm-hmm.
A lot of HHAP projects are just one funding source, and it's HHAP. So the fact that the county has shown a commitment to invest in that really will help raise the score.
Okay. Would you be able to provide a timeline that you could email to me of the submission of that grant, projected timeline for receipt of notice of approval or not, and then how that builds out construction schedule? You said it might go through end of 2026 then?
Correct.
Okay.
I can do that.
Thank you. Thank you. Do any of our committee members have questions for Chris?
I do. Do you have some sort of budget that you could provide for us? Because I've yet to see a budget of what the whole project looks like.
Sure.
So if you could even email that to us, that would be awesome as well.
Yeah, because we're starting to prepare that budget for the HHEB application, so we can provide you the overall development. budget.
Okay.
Yeah, I would like to see the overall budget. And I'm assuming that budget will have line items of the $300,000 that you've already expended, that you spent of the ARPA money, correct?
Yeah, typically what it does, it has the overall development budget, soft costs, construction costs, and then it has construction sources and permanent sources. The ARPA will be listed as both a construction source
Okay,
and a permanent.
yeah, I just
source.
want to make sure I can identify, looking at the budget, what you spent so far
Sure.
and what's left.
Okay, I can.
Okay, that'd be great.
Any other questions from other legislators not on the committee?
I
Mr.
did have another question, but go ahead. I can go.
You got another one, go right ahead.
Thank you. So the other question, as far as you mentioned in the beginning, I'll call it the litigation that is ongoing.
Mhm.
And you said you're able to continue moving on forward with the project. How is that possible? Like, what is the contingency of the litigation? Isn't it to prevent the project from moving forward? Or can you kind of expand on that a little bit, as much as you can? How can that happen?
Well, basically, the appeal was for the planning board approval. So the city of Auburn is actually defending their
Right,
ruling. So basically while the court is reviewing the application, it's not slowing us down at all. That was my point. Because we can't do anything until the HHAP application open.
but wouldn't it be the same that, I guess I don't understand, and correct me if I'm wrong, but I'm just trying to understand how if there's still litigation going on that hasn't been solidified, you may still be able to order things, you still may be able to follow through and apply for funding and that type of thing. But the project itself, can it not go on while this litigation has not been finalized?
Correct.
So that's my point. I just wanted to make sure for clarification, until the litigation is finalized,
We're in a
you
standstill.
can't start building and reconstructing
No.
and rehabbing that building.
So we're basically at a pause.
Okay,
We're not
that
spending-
was my
Yeah.
concern and my question,
But
is
I
that
would,
they're not able to move forward.
correct. We would be in a different spot if the
Right.
HHAP round was open and we were able to apply, but we couldn't because of the litigation.
Understood. Yeah, I just wanted my own clarification to make sure that I understood that.
No
Thank you.
problem.
Thank you.
Is there an environmental impact statement on this project?
So environmental impact statement is a secret requirement for a certain type of action. And this project was not doing that type of action. So we did what's called a long form environmental assessment form. So that was submitted as part of the site plan approval process.
So the planning board gave you permission, correct? And then this Article 75 is appealing their decision.
Well, they didn't really give us permission. So on every action that goes in front of the planning board, they have to make what's called a secret determination, which is the environmental impact.
Yeah, there's negative environmental impact.
Correct, but first they have to determine what type of action it is, and that will determine what type of information you need to submit for them to make a decision.
So they didn't rule on this already?
They did,
Right, and they ruled in your favor, is that correct? Sorry.
they did. They reviewed the long form environmental assessment form. They reviewed it line by line, and they issued a negative declaration, which means no adverse environmental effects.
So you're allowed to proceed if it wasn't the Article 75, which is put at a halt.
Correct.
Article 70, I'm sorry, because they're basically appealing the city's decision.
Mhm.
Okay, what's your contingency plan if they lose?
So if the Article 78, the judge really has three options. So the appeal is that the city didn't look at it close enough. So we would go back and we would prepare an EIS or whatever other additional information that the court felt the city should have looked at. So we would continue that process going forward. That would be the contingency plan going forward. If we're unsuccessful at that point, then maybe we look at potential other sites or abandon the project.
Mr. Strong.
Thank you, Madam Chair. So I guess what I'm asking her, is there some sort of document that gives us an idea that of what it's gonna cost to operate this facility? Now, it's obviously in the city. The city is the one that's giving you the blessing to operate this facility if it gets past the Article 78. Who's gonna pay for the operation of this facility? Water, the heat, the sewer, security, the whole 9 yards. What's it gonna cost to operate this facility? And is it gonna cost the county or is it gonna cost the city?
So we've had some conversations with DSS. And we plan on building the shelter, and then the rescue mission and DSS will enter into a operating agreement to run the shelter. Is that?
So in essence, the county would be paying you,
No, not us, the rescue mission.
the rescue mission,
But
but it's still county money.
So I guess my question is,
Yeah.
is there some sort of,
Yeah, it's all county money.
is there some sort, I'm taking it on faith that, there's gonna be X amount of dollars to operate this thing. Is it all grant funded? Is it 100% grant funded? Well, the question is I don't want one of the taxpayers down in Moravia, who I represent, come to me and say, why are my tax dollars paying for shelter in the city that I get no use out of? Or, why am I paying for it? That's the bottom line.
Right, right.
Legislator
Disappointed.
Daley.
They're paying for the hotels now.
I understand it. That's a whole nother subject.
No,
I
no,
get
no.
it.
This is a mandate of the county Department of Social Services to pay the cost for emergency shelter. And it is spread over the city of Auburn and the county taxpayers.
How much money is the city put up for this right now?
The
That's
city
what,
has no obligation to house.
so it's not a
homeless
city project.
people. It's zoned in the city of Auburn, and that's the process that they went through with the zoning board. There's only certain locations that are zoned, and I got new gray matter, Chris, when we were talking about this, that you can't just put a shelter up anywhere you feel like. It has to be zoned, and they tried to move it to a different location, and they didn't get a variance. So, again, this, and what I remember, and Christine would give more information, is eventually the rescue mission will have an operating budget, and they're going to charge the Department of Social Services up to 90% of their operating budget to cover the cost of operating the shelter. And, it is not, you don't have that figure in your hand right now.
No, we don't have a current figure.
No, but the goal is to pay for emergency shelter for people in this shelter versus scattering them all through the city of Auburn and in Weedsport or wherever else you can find a room for them. But at the county's taxpayer expense. And if they're safety nets, then you get 29% reimbursement and the county pays 71%. It is an expensive proposition, but it is not the city of Auburn's obligation to meet that need. It's the county's.
And Mark, same thing, you're right, your taxpayers down in Moravia, you're right, they're like, it's my tax dollars, but to your point about city dollars and county dollars, the county gets their money from sales tax and property tax. So as you know, the property owners in Auburn are also paying county tax.
Yeah, I know.
So as you know, so this is being shared. So in essence, the city is putting into it by tax dollars as well, but it's all coming into the county. They're not paying out of their own pocket.
So I guess my question is that, is the city going to send us a bill for water, or is when every time the ambulance or the fire service goes there, who's going to get that bill? The city or the county? Because the ambulances don't run free.
No,
So, I mean, again, so who's going to pay for
the
that?
city of Auburn's already paying when the hotels have emergency calls and there's, fights, and it is, lawyers, it's the city of Auburn's police force and the city of Auburn's EMS services that are covering the hotels and all the issues that come with that.
See,
They're doing it now.
right, but I think these are the questions that we have. We don't have anything written down that specifies, just like what Mark said. Okay, how is this going to work? How is this going to operate? Who is responsible for what? I mean, if we can see it visually, how it's all going to be laid out, then we can digest all the information and be able to make an intelligent decision of how to move forward.
Just as the city of Auburn's having concerns about what's happening in the hotels in the city of Auburn.
Right.
If they could stop that practice from happening, they would, but they can't. So, you know,
So
it is a
here's,
difficult situation.
here's my issue, okay? Is this is an 82 bed facility, if I'm correct?
Yep.
Well, I know for a fact, we're putting well over 82 people in hotels and families. So obviously, we're not gonna stop putting people in hotels.
Well, you'll have.
And is it cheaper to keep putting them in the hotel instead of operating an 82 bed facility that has to have security, you know, all the things that's gonna come with that building?
Not if you're looking at, you know, meeting the needs of these people in the hotel and stopping what some people feel is, geez, I need a roof over my head. Oh, all I have is this, oh, you're going to put me in a shelter? No thanks. I don't know what's going to happen, Mark, whether there will be people that opt out or there won't. But there are people that are in shelters getting no services at all, just a room, and whatever happens, happens.
Right, this is the shelter is more than a building, and the plan is more than beds to sleep in. It includes a day room, meals, case management on site. And the models across the nation show that this kind of model for people who opt in, and if they don't opt in, we have no obligation to put them in a hotel room. They don't opt into what we have. We've met our due diligence. We don't have to put them in a hotel room. They can figure it out. So for those who opt in, the model shows that we will have more ability to move them out of homelessness and into sustainable, self-sustaining living environments than what we're currently doing.
I understand that, but I know that one of the things that, you know, that I've heard is that, you know, if we go into a shelter situation, you know, there's going to be counselors, there's all kinds of things that we're going to provide these folks. I'm grateful for the fact that we're going to create jobs, but again, is that going to put a burden on the county to pay for these professionals, to give them the services that, you know, we feel that they need? I just, that's the reason I'm asking, what is it going to cost to operate this thing every day? And I've never seen anything. I don't know if anybody in this room has seen anything as to what it's going to cost.
No,
I can talk a little bit about some of the efforts to remove some of that burden from the county onto other sources. So the rescue mission has applied and received an award through the Empire State Supportive Housing Initiative. That's partly why we put some of those transitional units in the shelter. So they get upwards of $25,000 per bed to help operate some of those units. And that will pay for some of the case management services and other things. That's a 20-year contract with the state. So, so again, to try to help combat some of the current homeless issues that are faced with the county, you know, to again have that offering of a shelter and then have services provided on site and then have an opportunity for, you know, transitional or permanent housing, we think will help, you know, set the path for people to ultimately get their own home.
Correct me if I'm wrong. I think you operate as one of these type shelters already currently somewhere.
We're not in the shelter operating business. We've built a few of them. We've raised the capital for them and then we lease them to an operator like a rescue mission. So we have one.
I guess what my question or my ask is, obviously there's, these buildings are somewhere, somebody ought to have some sort of an idea what it costs every day or every year to operate this thing. I'd like to be able to, sit down and show this body, this committee, this is what we're taking on. This is the money that this facility is going to cost the taxpayers of this county. I agree. I understand we're spending money putting these people in hotels now. I understand that. The fact of the matter is we shouldn't be walking into this project blindly. We ought to have some sort of idea in writing. I'm not to be held to, but it gives us an idea. Hey, this is what you're looking to have to spend. Cover it with grants. Is it some of it being able to be covered by grants? Is it not? The bottom line is, what is it going to cost the taxpayers of this county? And I think that's a fair ask of this whole committee, project, whatever. It ought to be in writing so that we got an idea.
I just had a follow to Mark's.
No, go ahead.
I think you have a very valid point. What would it cost? What's it going to cost the county to operate the shelter? And, what are we going to pay for this contract? What I'm not clear, and maybe Chris is the rescue mission prepared to give that dollar amount at this point in time? Or I got the impression that until there's a contracting, I don't even know what goes into having them predict the 90% of operating costs.
Well, I guess a follow-up to what you just said, my question to you then, or Chris, would be if they're applying for grant money, right? And they're kind of looking at a fiduciary type of position and they're going to manage it. Are they doing the budget? Who's doing the budget for the project?
We're doing the construction budget, what's going to cost to build, and they're doing the budget.
They're doing the operating budget.
Right. So in terms of staffing, security, whether they can negotiate.
Because they're going to cover their costs, right? They have to cover their
Yeah,
costs.
so in my mind, like to what Mark is saying, we should be looking for two budgets. We should be looking for a construction budget from you and then an operating budget from Rescue Mission. And then I have one last question. So this type of building, just in general, how long does it take you to build this type of building? If you didn't have any of these other things going on, typically what is the time frame for you to build?
One building like this, there are some different parts of it because of the build out, because it is a shelter. But we typically budget from 12 to 18 months for construction.
Thank you.
Is it paid by, do we have to pay prevailing wage to build this building?
HHAP does not require prevailing wage, but it will have a hefty minority, women, business owned, local contractor to civil veteran portion of it for the construction.
Any other questions or? Christine, did you have anything that you could add for clarity with any of these questions? And we've talked about this for several years in terms of contracting with Rescue Mission.
So I can say that we did get a preliminary budget just to talk to Rescue Mission about back in 2023. So we're talking almost a couple of years ago. We met with them to talk about, their model of providing shelter. They talked a lot about, why they build in certain services, like their maintenance, different things for cleaning, things that seem expensive on the budget. And they talked about why that's important to have that way. They talked about their staffing model, overnight staff, day staff, maintenance, things like that. So, and their utilities, laundry, all kinds of things. Like we learned a lot about like how they go about operating a shelter. So back then in 2023, I have a dollar figure from 2023, but it's not something that I would say that they could be held to now, that this is what it would cost. It was close to $2 million.
A year?
For the 80 beds. When you break that out, my math is incorrect, so, somebody can check me. But if you have 80 beds being provided for the $2 million, 365 days a year, it's about $68 per bed per day, per person. They would basically need. The way that their financial model works is they would bill the Department of Social Services for a monthly amount. And on the back end, the Department of Social Services has cases opened and certain funding streams for those people that would be staying there. And we would be paying lines off of their cases that we have open with DSS. Some of those folks have different reimbursement levels, so some of them wouldn't have any reimbursement. So it would pretty much vary based on the population of the people that were in the shelter that month or that day. I know that Crystal Cosentino from the Rescue Mission has offered to come here. I'm sure that she would be more than willing to come in and speak to anyone here about more in detail about the budget and about how they go about coming up with the operating budget and how that would work. But that is what I have right now. I'm happy to share that 2023 document with you. You can look that over, but it's definitely not something, I mean, that I know that she would want to be projected out, that that's how much it would be in 2 years or
Right.
something like that. One of my resolutions tonight is for the 16-bed shelter on Grand Ave right now, and that's over $500,000. So, when you're talking about 2 million for 80 beds, it's almost $500,000 for the 16. So there's a lot to consider. What else? Do you have any other questions for me or things I didn't talk about? Okay, I hope that helps a little bit.
Thank you.
Thank you, Christine. Any other questions? Chris, thank you so much for
Yes.
the drive
Thank
out,
you, Chris.
Thank you.
Thank you.
giving us
I'll
the
get you
update, especially, yep. The use of ARPA funds update. Thank you. Okay, our next presentation is from Monica Salvich, who's going to give us a 2-year update on Healing Cayuga grant. I'm sorry about your arm. I see something happen.
Yeah,
I'd like to see that number too, actually. And the comparative cost.
Madam Chair, I need to run out and grab my glasses.
Okay,
Just
sure.
a sec.
I'm gonna stay here one day.
But I sit down.
Yeah. While they pull up their presentation, I'm here tonight to talk about a grant project that we've been working on for the past 2 years. It's a substance use diversion program. And okay, so what is that? It's a federal funded grant program funded through the Department of Justice, the Bureau of Justice Assistance, through their comprehensive opioid stimulant and substance use grant program. And so towards the end of the Healing Community Study, I was applying for this grant funding because we knew there were some things that we wanted to continue. And we also identified some gaps in the system that we could not address with the Healing Community Study because it was outside the scope. So we applied for this program. There were 86 awards given out nationwide, and we were one of 8 awards that were received in New York State. Cayuga County Mental Health was the awardee for the grant program, and we received $1 million over 3 years. The program started in October 22. And so now in September this year, we just finished our 2nd year out of the 3 years. And so I thought it would be a good time to give an overview of what this program does and what we have been working on so far. So what did we propose to do? We wanted to reduce overdose fatalities in Cayuga County by embedding recovery peer support and other targeted services at specific points of contact for individuals with substance use disorder, and thereby diverting them from the justice and child welfare involvement towards treatment and recovery. Let's see. So who are our partners? And a number of them are here today. The Auburn Intervention Corps, the Auburn Police Department, Cayuga County Departments, a number of them, 911 Emergency Center, the Department of Social Services, the Sheriff's Office, CHAF, our treatment provider, HELPRA, Liberty Resources, and Nick's Right for Friends. And so I know the sheriff is here and Denise is here and Ashley's here from Nick's Ride and Christine is here. So at any time when I'm talking about the parts that, that you've been working on as our partners, feel free to chime in with your perspective. So what was funded or what is funded through this program? On the one hand, it's the management and the support of the grant administration. So that's 50% for a project director. That would be me. And then 15% for an epidemiologist, Dr. Corinna Noel out of Cornell, who's been working with us on overdose data surveillance for the past several years. So she's also part of this program when it comes to data collection and reporting. And then 7% for an implementation consultant, that's Matt Rosa. He's also been working with us for a number of years. And he's providing technical assistance and coaching for our partners as we're implementing those programs. On the implementation side, this program funds the equivalent of 2.5 full-time peer specialists, almost half of an Narcan outreach coordinator, 14% of clinical assessment that would go through CHAD. And then also through the epidemiologist, she's been working on developing and maintaining our overdose data dashboard that's on our county website. So that was also part of this program. And then some other expenses that come along with the Narcan distribution program, like supplies and boxes and things of that nature. Some funds are in there for housing assistance, transportation for program participants, and also training. So the first thing, obviously, the biggest thing that we wanted to do is reduce overdose fatalities. And so here I have a graph that actually shows, not by calendar year, but by grant year, what that situation looked like. And you can see over time, our overdose, reported overdoses have declined, and so have our fatalities. And then we're looking at where those overdoses are happening, because one focus of this particular grant program is rural areas. So we break down where fatalities are happening within the city of Auburn and then outside. And so on this graph, you can see that over time, outside of Auburn, the fatalities have actually come down. The first year, it looks like it has gone up just because it's not calendar year, but we had some fatalities at the end of the year, so it sort of slipped in there. But overall, from calendar year to calendar year, overdose fatalities have gone down. Here, it's just shown a little bit differently because of the weird grant year. And so the first thing that we looked at when we looked at the child welfare system and then also the criminal justice system, what can we do to help people who are involved in those systems, and oftentimes at multiple systems at the same time. So we came up with the idea of embedding peer support services in various different settings. So one would be, and that's the red part of the column, child protective and foster care. The green one would be cap arraignment, which is happening twice a day at County House Road. And the blue one is peer support at post-release from jail and reintegration after incarceration. So here you basically see over the last 2 years, and it's more like 1.5 years because it took some time to get those programs up and running. We had about 260 individuals who were engaged in peer services, and that was through Nick's Ride. And the breakdown is also in per sector there. Notable is that 43 of those people were engaged in more than one setting, and that goes to show that sometimes it's really hard to break down where those people should be counted, right? Because oftentimes they just are not just getting services in one sector, because those sectors are for us. The people really don't care. They go where they need to go to get their services. So that speaks a little bit to the difficulty of collecting data and reporting on data, because it's not so clear cut. And Ashley could tell you a whole story about how difficult it is to keep those numbers straight. So first off, we wanted to support families that were impacted by substance use disorders. And the goals there were to promote parents' entry into an engagement in substance use treatment and recovery. Also support the parents to meet the requirements of their treatment and child welfare case plans, and then help families remain together safely. That's the ultimate goal. So our approach was a collaborative team. We called this initiative Keeping Families Together because we needed a name where we could just refer to it constantly. That's what we came up with. And so those are peers from Nick's Ride, and then case managers, caseworkers, supervisors from Child Protective and foster care. And so we had peer support embedded there, so they're working hand in hand. And as we were going along with this process, we learned that it's not enough to just say, okay, now a peer works out of DSS. We had to do a lot of education and work around figuring out what the role of the caseworker is versus the role of the peer and what those boundaries are, and also for the clients that they know. So if they tell a peer something, certain things they would not share, for instance, with the caseworkers, because there are different roles. And then also that mutual respect between the caseworkers and the peers, that they all have their roles and they want to be working together ultimately to support the children, for their best interest, but also for the best interest of the parents. And then also figuring out the information sharing aspect, right? What can we do and how can we figure this out? And the desired outcomes were to prevent out-of-home placement, keeping the families together, and also promote parent recovery for people who were struggling with substance use. So what that looked like, and I know that's really small, or maybe it's just my eyes, but so over this 1.5 years, we had about 60 people that were referred to Nick's Ride out of those 2 divisions, and 33 were engaged, and 19 are currently engaged. The average interaction with peers was 15 times, and that's just the average of times they would give services. It would range from like 1 to 83 interactions. And that's really a lot, and that really goes to show that high needs of that population and that high time commitment that supporting them in that environment really takes. And services besides the peer support that were provided were transportation to get to appointments, to make sure they can see their children when they needed to, treatment appointments, court appointments, whatever it is. Also treatment admission if they needed it, and then also some housing support. And then we were also looking at how long do people stay engaged in this program, because the goal was to have at least 3 months of continuous peer support to see, that there's some ongoing relationship. On average, they stay engaged for 8 months. And again, that was to me at least a surprise, because that is really a long time. Because when you think, you see that we were only able to engage half of the people that were referred, because a lot of people are just not interested or are just not in the state of mind to be dealing with anything. They just lost their children. They have a whole, they have substance use issues. A lot of them are just not in a state of mind to actually engage. But the ones who did engaged for an average of 8 months. And that's really a great outcome, I think. So when we initially wrote that grant, and I had a lot of conversations with Christine about this, it's like, what do we put in there as outcomes? Like, what do we want to see? And that was really hard to pinpoint down. And so we came up with, we wanted 80%. We thought, it would be good to have 80% of the people who were engaged with peers to have no family court action. The reality looked more like 24%. For foster care, we wanted to have 50% of the people who were engaged have a family reunification, get their children back to their parents. It was more like 12%. And so as we were talking about it at our last meeting about this, it's really hard, with those numbers, because CPS and foster care, their timeframes don't go with our grant timeframes, right? With our years. And also family reunification means going back to their parents, but children often go back to another family member, and that is not counted. So we had a lot of conversations around, like here, it doesn't look great, but it's also a totally new program, and it's a really hard population to engage in. I don't have any other statistics like nationally or what that could look like. But those are our numbers and that's where we are. And we had 3 family unifications so far and 1 is on the way. And so to me, that's a win. I mean, that's 3, potentially 4 families. Yeah. Okay, anything you wanted to say to this, Christine or Ashley?
So I thought it would be a good thing to actually talk to the services. And I told them that I was going to be saying a few things here. Ask them kind of for their perspective on keeping families together and, just a thought, like a quick thought on the program and how, how they saw it, go for the families that we work with. And I wrote down a few things they said. DSS staff have grown a more knowledgeable perspective on those who are dealing with substance use. We have learned so much from Next Ride. We have new and better language to use in helping us engage with those with substance use disorder. We have built positive relationships with Next Ride and other service providers to help us build stronger partnerships, helping families. Huge success. We have had families who have been reunified with their children due to Next Ride's care support. More families have engaged with services and have been more open about their use with us. That helps lead to more realistic goals that we set as service providers. More advocacy for the families that we've worked with because of the program. More individuals seeking treatment because of the program. Next Ride has helped us better recognize those struggling, and in turn, DSS can be better in linking families to supports. Partnerships have helped us with diligent efforts that are required by court in working with reunifying parents with their children. The last one is the program has been very helpful for families and it gives them someone to relate to that has also been struggling and has had similar circumstances as theirs and have made positive strides. So I think that's better than anything I can say. These are the workers that have worked with that have these are the workers that have been working the program and are working with the families. So I think that it's been wonderful. I know we came up with some pretty lofty goals, and even though we didn't hit those marks or even close, I still think that it has been beneficial to the families that have worked with the program, even if, they're still working toward reunification, even if they're still in their continuum of, seeking the services and recovery. I think it's been well worth it. Thanks, Christina.
Thank you. Yeah, those are great quotes. And, it's a perspective we don't often think about getting. What did our employees learn that they can carry on and use after the grant?
Yeah, and so if you remember in the beginning when I said, stuff that got funded by this grant, it was our implementation consultant who's doing a lot of trainings. So he's meeting monthly, for instance, with CPS and foster care staff. And they talk about substance use. They talk about how to engage people with substance use. And I think that's why I like those statements so much, because I think it's really reflected that shift in how they think about the clients and how they're able to engage with them. You might not see it in the numbers, but certainly in how they're interacting and how they're working together and hopefully reducing the stigma around substance use and all that stuff, you don't always see in data, but you see it in the personal interactions. And that's why oftentimes, those trainings and those coaching sessions and all those things, we don't talk about that so much because it's not something tangible. But then when you hear those statements, that really warms my heart, because that's why we use consultants, and that's why we use people who have those skills to come in and actually benefit the people that we're working with. And
Right.
in that case, our department.
Indicates some work towards systemic change.
Yes.
And you mentioned that you weren't able to capture the data about kinship care reunification because it just wasn't eligible for the goals. But do you have a sense about how many children and families were reunited through kinship care? Because that is a good model.
I don't, but we talked about it at our last meeting and that came up because to me, I wasn't even aware of that, right? For me, family reunification, I didn't know that there were so many nuances to it. And so for that final year, we were talking about, do we want to expand it? Because those are our goals. Those are not goals that BJA prescribed to us. This is something that we wanted to know for ourselves, for our program locally. So could we include that just to show that they didn't enter the foster care system? They're still with the family. They might not be with the parent at this time, but they're with an uncle, a sister, whatever. And so I think it's really worthwhile to capture those numbers as well, because they're still within the family in a way. So that, and that's why those grant programs are great, especially when you start new programs that take some time to build up, because you learn those things. We haven't done this before. There's also not a lot of research out there nationally about embedding peers into, child welfare systems. So, we've been basically implementing this, by the seat of our pants, what we thought would be helpful, for our community, but there was nothing to go by, like no blueprint or anything from other communities. So we learn.
And I know you're very modest, so you wouldn't say this, but you were invited to speak at a meeting of the localities in New York State?
No, it was actually.
Or was it the national?
Yeah.
So of all the national sites, you were chosen to discuss this model just yesterday.
Yes.
Zoom.
It wasn't specifically this, it was more about our substance use response here in the county. So it wasn't specifically for this, but yeah, and that's what happens oftentimes. We get tapped for those things because there is no good data out there, even though, we show the data how it is, even if it's not what we expected or what we hoped for. This is what it is. We're not, masking anything. But the point is that oftentimes there is no data out there. So when other communities or policymaking bodies see that, they want to know, how did you do that? Or how did you get that data? Or how did you go about doing that? And so oftentimes we get tapped for those webinars or those trainings, to talk to other communities about this is how we approached it. And this was our outcome for that.
Excellent. 60 Minutes next.
We'll see. So that was families, right? So okay, now we also wanted to support justice involved individuals with substance use disorders. So on the one hand, there is cap arraignment that happened with the onset of bail reform, where people get arraigned twice a day at the sheriff's office, and oftentimes they get released, and then they're hard to find. So we wanted to have a peer there at arraignment to engage people right then and there. And the idea at the time was to connect them to treatment as soon as possible. And there was the Auburn Intervention Court, also dubbed as opioid court, which is a life-saving court where it prioritizes treatment over incarceration. So there is a program where, like, for 90 days, the charges would be held in advance and the person could focus on their treatment. But then after the 90 days, they would have to answer to their charges. So that was the idea, have a peer at arraignment and then have this pipeline to the Auburn Intervention Court, and that was all really great on paper. However, it didn't quite pan out that way because we realized that people were not really interested in that. So what happened, or what we saw happening, was that it was not an optimal place to engage, because people just got arrested. They have to see the judge. The defense counsel is there. There's a lot going on. There's not a lot of room for confidentiality that you can talk with the person individually. So again, we learned that it took a lot of education among the judges, among defense counsel, among, even parole and probation, to talk to them about what peers can do, what their role is, why they're even there, why do they want to talk to my client, right? And now we're at a point after, 2 years or a year and a half of outreach and constantly building those relationships, that oftentimes the judges and the defense counsel actually call the peer and say, hey, I think my client can benefit from your services. So even though that pipeline to the opioid, the intervention court didn't quite happen the way as we expected or hoped, because there's just not a real incentive because the charges are still there afterwards and people just don't find that very helpful. We did find that they were still able to engage 148 people who would have not been engaged because there was no peer there before, and there was also no plan for a peer to be there at arraignment. So what happened was that they still provide peer service, they still provide transportation, they still provide, all the services that Nick's Right provides. And that might be a referral to treatment per se, but it might not be necessarily a referral to that Auburn Intervention Court. Right, so again, that was something that we learned. Their peers engage with individuals on an average of 5 times, so anywhere from 1 time to 29 interactions, which is still a lot. And the retention there is almost also about 8 months. So again, a good amount of time, where they stay engaged with the peers. So in terms of the Auburn Intervention Court, we did have some referrals there. We're hoping for 30, we're at 13. People have successfully completed those programs and moved on. Currently, we have 4 in there. But again, they don't necessarily come from arraignment. They might come from other places. But again, we embedded peers in a place where they haven't been before and provide services, to people that otherwise probably wouldn't receive those services. And then the final one with justice involvement is also we wanted to make sure when people are being released from jail or treatment, that there is engagement and that there is help with reintegration. And so we had a goal of engaging 60 people. Overall, they were able to engage 23. I cannot read how many are currently engaged. And again, they interact with them an average of 9 times, and the retention rate is actually 11 months. So again, there is a lot going on when people are being released from jail. And so having them being engaged for almost a year on average is really a long time. One of the services we provide there, we started a housing assistance fund because we had some money that we could use for something housing related. And the idea was there to help people when they get released with move-in assistance. So a first month's rent or a security deposit, they might not have money saved up after they got released from jail. So we can help with that. But we were looking for people who were actually able to pay their own bills afterwards. So we didn't want to have anything ongoing. And so again, that proved to be difficult because oftentimes people are not ready for that. So again, after our last meeting, we talked about, for that last year, do we want to expand our guidelines to say, well, maybe not just the move-in assistance. And I know Fred is looking at me because he will look, obviously legal had to take a look at those guidelines and everything. So we're thinking about, do we want to expand that maybe and pay for a few months their rent until they are able to pay it for themselves? Is that more realistic? So that might be something that we could be doing for the last year because we do have money left over. Again, those things we figure out as we go along and adjust. So anything from you, Ashley, that you wanted to add, because those were all peer services in all those different settings.
There's so much I could say, but I could say that, there's always the initial goal that we strive to work towards, following grant implementation. And then there's like what happens in actuality. We certainly have had a high level of engagement with the folks that have engaged through these different touch points. So whether it's post-release, cap court arraignments, or child protective services and foster care division, I would say from my perspective that what I've seen to be one of the biggest successes of this work so far has been the partnerships that have grown with the Department of Social Services, and then also the opportunity to develop a working relationship with the magistrates in the county
to talk to them and have a real discussion about substance use, and how it doesn't discriminate and it can affect anyone. And, you know, we have some corporate events throughout the year and some of the magistrates actually come to the events. I would say that's a huge, move in the right direction. Kind of breaking down barriers that existed between the human service professionals and some of these other agencies that, were really kind of siloed from us prior. And now we have open lines of communication. We have developed professional relationships with the workers at CPS and foster care, as well as assigned counsel. We've already been able to find an attorney for our board for this process, which was huge for this ride. So I really think that this grant has shown us where the people that are struggling most with substance use and unmet mental health needs are likely to be found. And as Monica pointed out, you know, as we were implementing this grant, we were also building out our software internally. And we made a thing called a grant association, so we can associate clients with where we encounter them and where we engage them. And we can kind of start to see this overlap, so we know exactly where the most high-risk folks in the county are. And so I think that's been a huge benefit to this, is just, you know, getting to know other stakeholders in the community that have a hand in helping the community be safe, helping individuals rehabilitate and reintegrate and away from the businesses that they've once covered. So it's been a pleasure getting to know these different organizations and entities. And I think we do have positive relationships that will continue on into the future.
Thanks, Ashton. Yeah, we didn't pick the low hanging fruits for this grant. I mean, this is really, those are really populations that are, have a lot of need, a lot of intense needs and difficulties to overcome. So besides the peer support, another part of this grant was also rural outreach and Narcan training. And so we've been doing Narcan training for quite some time now. And for this particular grant, we wanted to really focus on getting out into the northern parts, the southern parts, and really, you know, not just give out Narcan to anybody who wants it, but like address the stigma, have those conversations about why it is important and why they should have it and how they can help, empower people to help when they see an emergency. Because especially in rural areas, it takes some time for first responders to arrive. And those few minutes when somebody administered Narcan already can really save somebody's life. So we went out and, you know, we hit some events like recovery events in the community, senior events from our own OFA. We were also able to get into some rural school districts, which was really a hard thing to do. Southern Cayuga, Cato, Union Springs. We were also working with municipalities like Genoa, Venice, Montezuma to train staff there, but then also put the wall boxes on their municipal buildings. Port Byron Library, Cato Rec Center, some manufacturing companies, fire departments, churches, BOCES, and also some town courts. So in total, we trained 895 people outside of Auburn. And that's in 2 years. So that's really huge, considering you all know our geography and the time commitment that takes to get to all those different parts. Not just to have trainings, but also build the relationship first and find the partners and find businesses who want to have their staff trained and who want to partner with us on that. We also we plan to have 8 events in rural areas. We did 30, and we trained 128 first responders. And we started to develop good relationships with some of the departments, because oftentimes they only have a little bit of Narcan at hand, you know, just enough for their rigs. And then when they would have overdoses and they would run out, they would call us and say, hey, we had overdoses over the weekend, you know, can you provide us with Narcan? And we would do that immediately. And that's huge, because that did not happen before. We trained 336 school staff and students outside of Auburn, and we plan to place 20 wall boxes in public spaces. We placed 49. So overall, in terms of the numbers given out, I think that's really huge for Cayuga County and for our rural areas. But we don't want to just look at how many Narcan did we give out. We also want to see well, do people actually use it? Because that's the main part. It doesn't help us if they're somewhere in a drawer. So again, here you see in the red part, this is Narcan given out in rural areas. So from one year to another, it has increased significantly, actually tripled. But then when you look at the Narcan administration, again, that's small for here to see, but the Narcan administration has actually doubled. And here we're only talking about bystanders, not first responders. And so more often than not, when a first responder arrives, an overdose witness has already administered Narcan. And again, that helps those few minutes to help somebody, save somebody's life. And that really, you can almost see it identical as the bystander administration has risen in the red columns on the left. The turquoise columns on the right for first responders in rural areas have come down because they were not the first ones to administer Narcan anymore at the scene. And that's how it is recorded in the system. So I think that's huge because oftentimes, people say, oh, you're just throwing Narcan out the window and we hope it sticks. And I just read an article about somewhere in Ohio where they were saying, oh yeah, we give out so much Narcan, but people still don't want to use it because they're afraid. And they are not confident. And again, that goes back to our trainings. We're not just handing out Narcan, we're having those conversations and we get people comfortable using Narcan. And those numbers clearly show that they are and that they're saving lives. And then another thing that we wanted to do, this whole program has a lot of different intersects where we wanted to make a difference. And so we were talking, with law enforcement and, they were saying, we have a lot of mental health related calls. And it would be great, we have mobile crisis teams, it would be great if we could get help with that. Right. So we were thinking about how could we divert people in crisis away from law enforcement response when it's appropriate towards a mental health response. And so we were working with Denise and her team on adjusting protocols in a way that would maybe facilitate that when people call dispatch and there are certain workflows and certain, questions that they're asking, and it would be appropriate, to send, say a mobile crisis team or, not directly send law enforcement. Would that work? It did not work so well right from dispatch because it's a big, you got to imagine it's a big mind shift from doing that for dispatchers. So, and oftentimes what happens is law enforcement will be dispatched and then they say, oh, and send mobile crisis too. Or they're there and then they call for mobile crisis. So this happens quite frequently. And here those numbers show the 911 calls in the greenish on the right-hand side, like over 1,000 just last year, that were mental health or substance use or suicide related. And then Liberty Resources, who's doing our after hours and weekend mobile crisis responses for years now. We had 408 calls, 57 of them, so just over half of them were stabilized in the community. And that's really what we want. So law enforcement doesn't have to bring them to the hospital and wait there with them. And so when mobile crisis comes, you can see that more than half of the time people can be stabilized in the community. And the smaller column there on the left-hand side, that's our daytime mobile crisis team and mental health that just started last year. There we had 92 calls and 73% of them were stabilized in the community. So almost 3/4. So again, no hospital visit. None of those resources had to be utilized. And so what we want to do in this final year of that grant is, first of all, we're using part of the BJA money to fund the daytime mobile crisis team for another year to help them get up with capacity and also to get it utilized more and get people to actually call it and get referrals to it. And we want to see what those numbers look like next year in terms of can we either do a co-response more often or can we get to the point where maybe we send the mental health professionals there directly And so I don't know, Denise, you're here and the sheriff is here, so I don't know if you want to say anything to that part, because that was, and I talked with a lot of other communities who try that. It's not an easy thing to do.
So we had to make a little bit of a transition in dispatch because initially I think we were a little too stringent on when we send calls to the mobile crisis rather than sending law enforcement. And a lot of it is, trying to cover your butt as a dispatcher. We want to make sure that we're not diverting something that should require law enforcement. But what we learned was that at any time if we divert that call and they sense there's a little more going on, they'll throw it right back to us and we'll send law enforcement. So we got our policy a little bit to make it a little more lenient for them to transfer calls, and I think it's working out a little bit better. But we still send law enforcement, probably more than we want, but that's just.
Brian, any?
No, just with the challenges we have with the increase in need, the mental health problems that we just have to continue to think outside the box to try to address these things in an appropriate way. So I appreciate the opportunity to give these things a shot.
All right, so we talked about this a little bit before in terms of the training that we are providing for our partners. So over the last 2 years, we had 48 trainings that we provided to all the different agencies that we're working with, 314 participants through those trainings for, either through our epidemiologist about data collection, reporting, or through our consultant about skill building and coaching. And I talked before about our data dashboard that's on our website. So this is our epidemiologist next to me. And she was actually working with a grad student at Cornell to do an evaluation of the user friendliness of our overdose dashboard. And they actually just submitted it to a public health review to actually get it into a paper about the findings that they had. And yeah, in terms of communications, like we said before, there are tons of, I go to a lot of conferences, I do a lot of presentations locally, statewide, nationally. We always do articles in the paper to let the community know about what's going on, and also work with the media to get information out that way. And that is it. Thank you.
Thank you. Very thorough.
Yeah.
Very thorough.
Any questions?
Yeah. Any questions before we move on to department head reports and resolutions? Right. Deborah, Dennis, I'm going to put you on the spot. I don't think you have any resolutions. So any department reports and updates to share?
Oh,
no, I
no, never mind.
Just really quick, just wanted to say thank you to everybody who was involved in student government today. Again, I think it was a really successful day under some logistics we had to overcome this year, but we had 88 students participate from 6 of the 7 Cayuga County areas. Unfortunately, Cato had to back out at the last minute due to another obligation, but they would hope to be back with us next year. Our guest speaker was wonderful, that Alien had coordinated for us, Joe Nene from Micron. He did a wonderful job, and I had a lot of great feedback from the teachers in regards to that. New York State OCFS applications have been received. I have 16 of them. 5 are completely brand new to the Youth Bureau. So all those applications are out right now with the Youth Advisory Board reviewing them by November 15th, and then we will meet after and vote at that time. And that is all I have really right now. Anyone has any questions?
Thank you.
Thanks.
And then I'm going to move to Brenda Weinman. You have one resolution, so we'll move you right along if you'd like to come up and introduce your resolution, which is HH 13, the last in your packet.
Well, this is a routine resolution. We have a meal program that serves 70,000 meals a year to homebound seniors, and this is a contract with the provider who was selected from the RFP process last year. They have an option to renew, and I would like to pursue that option with this contract.
Can I have a motion to put HH 13?
Motion?
Any discussions or questions regarding the authorization to sign a contract with Trio Community Meals LLC?
Are you getting positive feedback about the vendor services they're providing as far as the alcohol?
Generally, it has been very good. We do a survey to all the participants and there's just been a handful that have not liked the meals. I had talked a little bit before that our prior meal vendor was very lenient and was really following people's likes, not necessarily the required RV requirements of our funding stream. So this new vendor, they're working much harder to follow those guidelines and that means salt,
No
sugar.
potato chips.
I know, right? Tater tots, none of those yummy things. And they're trying to be also more creative about different food preferences amongst different people. So.
Okay. Any other questions or discussion? All in favor, HHS 13?
Aye.
Aye. Any opposed? Abstained? It's carried. Thank you. Thank you, Brenda. Other reports?
Yeah, I just wanted to share here so I can give you some visuals. So we are in the middle of the Medicare annual enrollment. During the Medicare annual enrollment, I'm sure everybody's seen, we're just bombarded with Medicare ads for Medicare Advantage plans, Part D plans. That's our population, 60 and over, plus anybody who is on Social Security disability and has Medicare. We welcome any of them to call us for assistance with that process. But I did want to give you a visual, as I haven't done this in a while. When I put this first screen chart together 10 years or so ago, it kind of looked about like this. And now it includes all of this. These are Medicare Advantage plan choices that people have in Cayuga County. And they vary by county. So we have to put together, our HealthCap coordinator puts this chart together every year because there is no version of it available online. Individuals trying to determine what plan they want only are able to get individual plan information from individual companies. We want them to have a side-by-side comparison to help them make decisions. But as you can imagine, it's pretty overwhelming. A lot of people will come in because they've seen something on TV, seen something in a magazine, their friend has a plan. Our insurance counselors, we have one full-time person and two half-time people who do insurance counseling. We'll sit down with them and really go over the pros and cons of whatever plans they're looking at. They also will look at if somebody chooses to do a Medicare supplement plan instead of an Advantage plan, and we have to explain what the difference is. There are multiple Medicare supplement plans available with multiple different companies. And then folks who do that also have to pick from a shorter list than there's been in previous years, but I think there's about 18 on here, 14 or 18 prescription plans. So it's getting more and more complicated for our staff to be able to go through these processes. It's taking much longer. People want to come in because they've heard a great ad. So we go over, what the ad particular plan is, but then we also enter their medications by hand into Medicare.gov. And based on their medications, Medicare.gov does a calculation as far as cost effectiveness, which plan makes the most sense. We give people that information. So it's just a super, super involved process. I'd welcome any legislator to come in at any time and sit down with one of our staff who goes through this process. It's easily 45 minutes to an hour with each individual. We have had 369 people call since the Medicare annual enrollment began. That's roughly about 25 working days, 369 people have called. It's a pretty intense process as the population is aging, as these insurance products have upped their advertising and there's so many of them. It's become a significant challenge for our office, but our staff are trained by the state using Medicare and Medicaid guidelines. They're tested every year, so they have to be certified to be able to do this counseling by Center for Medicare and Medicaid Services. And they are the only ones in the county who are doing this work, who aren't selling the product. So there'll be people who say, well, I can go over different versions of different products, and they certainly can. But we're gonna look at every single product that's available for an individual. We have no stake in what they decide. We just want them to get the product that's gonna work for them. So this is a huge component of what we do. It's our office with the new phone system. It's kind of been interesting because, somehow it defaulted that the way we're set up, we all kind of help cover the front desk. So what that means is we have a primary person who checks all those phone calls, takes all those phone calls. But when he's not present and things go to voicemail, it comes to a couple of our emails. And it is astounding, and I've been there, 18 years, it's astounding how many calls we get. One after another, after another, after another. And every single person believes that they are the only one that really has their plans being dropped, or, their doctor no longer takes it, and the urgency that all these folks have wanting to get in their office. And as you can imagine, one full-time, two part-time people trying to see all these people before December 15th. It's almost too much. We're at the point where it's really almost too much. This will probably be the first year where we've sent significant numbers of people to the state for assistance, because the population is increasing. Medicare Advantage came to our county roughly around 2010. We've had a 35% increase in the population of 60 and over since then. We have not had an increase in staffing anywhere near enough to keep up with that. So I just want to share that we want to meet this need, but our resources are limited, and we do whatever we can humanly possible. So just wanted to share that.
Thank you.
Also, I wanted to just give you a couple quick updates. We talked about our resource fair a little bit last time. And we are doing more with the building application. The Finger Lakes Daily News to get that up. So we are getting regular calls about that. We're also participating in a SUNY Upstate and Syracuse University project to provide memory screenings for those who are concerned about their cognition. So these are two new programs that we have again picked up because there's a need in the community. We're registering people and getting people signed up for rides. We're working on the cognition. I just want to give that as an example of how, there's needs out there and we work to meet them with the same people, same staff, we're just doing more now. So I'm very concerned, where that's leading us, how much longer we can do that with the resources that we have.
Thank you. Excellent work. Dedicated work. So we'll follow the script now, and Kathleen Cuddy. You've got a couple of resolutions we can look at first.
Go this way, rubbing your back.
You're good.
Yeah,
HH1 is a fill of Director of Health, Education, and Public Information.
correct. That position, the individual has taken a new position. It's ideal for her, but we were really sorry to see her go. She's marvelous job with us. So we are looking to fill that vacancy.
Okay. The motion for HH1?
Motion?
Thank you. A second? I'll second. Any questions?
It says on it that's partially reimbursed. What is that partial reimbursement rate?
So it varies. It's state aid reimbursement and it's grant funding. So depending what grants this position may have a percentage of their time under, and we can take that percent of the salary and the fringe benefits. Anything that's not covered under the fringe benefit would fall under our state aid funding formula. So that is part of the formula where it's all of the salary for those qualifying people until we meet the $750,000 base grant, as well as 50% of the fringe benefits of that role until we meet that $750,000 base limit.
then both up to, then we get 36% on the dollar for salary and 36% on the dollar for up to 50% of the fringe benefit.
Who's filling the position while it's vacant?
It would be our deputy director and myself and education staff.
My struggle is, and I'm gonna be upfront, this is November. Obviously, the budget was dropped in 10 days for last. I just can't right now support filling positions until I see the budget. I'm not saying this won't get filled eventually with kind of, I'm gonna go, but right now, I just think I'm taking a pause on these until after we see the budget. Yeah, so just so you know where I stand.
I would be naive to think that some of you might not be thinking that way. So part of the information I brought was to give you a better sense of the type of work that is performed by this work. This particular job, the person supervises 4 full-time staff, 4 public health fellows, and a contractor. They administer, we have, as all of you know, multiple grants within the health department that provide offsetting, they offset the local share cost to meet mandatory programs. Okay, so in this case, this particular position administers $1.7 million worth of grants annually that we do. That is not even including a couple grants that are forthcoming that we haven't been able to get off the ground yet. Amongst them is the lead poisoning prevention, right? The bike and wheel sport, healthy neighborhoods, tick prevention, which were some special grants, emergency preparedness, the fellows program, and our infrastructure and workforce data program. There's the grants, they're supervising the actions that are done. There's getting the submissions for the quarterly reports. Then there's the mandatory, not glamorous stuff, but required stuff, the community health assessment, the community health improvement programs for which we must provide that information. This will also, though, that's talking about a lot of the education work, right? And I've got some information about the outreach that we've performed. The public information is just as critical, right? And I know all of you know this, but I'm sharing it with you again. That is the education, which is important, the informative things, but as critically, it's the time-sensitive, urgent things, right? When the village of Cato didn't have water on Wednesday before Thanksgiving, it wasn't just me and our environmental health person working with emergency management. It was our health education information person who was right along with us to get that information out to everybody. Those are skill sets that work in conjunction with all of our departments. This is a position that covers all the departments, all the divisions within our department, and certainly helps support other departments as well. I would be remiss in not acknowledging that. So it just gives you a sense of the significance of this role to the department, but to the community and the county.
I appreciate that, Captain. Thank you.
How long has the county had a director of health education, public information? How far back does it go?
3 years now. We did some restructuring out of necessity, right? For a long time, we didn't have certain roles that they were vacant. And this is the direction, more of our work as a public health department goes toward education and prevention as a means to help provide information and services, but also to prevent long-term costs to people when we can get them engaged versus how it was 10 years ago when we were a lot more direct care service, 15 years ago, even when we were a lot more direct care service. So there's definitely been an evolution within local health departments in that regard.
Thank you. Any other questions, discussion? All in favor, we put it on the floor, yes. All in favor?
Aye.
Aye. Any opposed?
Aye.
Abstained?
No, aye, I'm opposed.
I counted, I asked.
Sorry.
How's Hans voting?
I'm just saying.
Yes.
So that fails. And you have HH2.
That is part-time rabies coordinator position. We have the person in that role who is retiring after 20+ years of service with us. I will say there's the benefit that this person is an employee in some kind of capacity because it is a savings to the county by having them as an employee part-time than it would be to contract out. This person actually had some good information. It's been wonderful. She's earned the right to retire. I wrote down a little bit more information. It's very seasonal, as we know, what the rabies coordinator has to do. It's all year round, but it's particularly that role is busy during the spring, summer months with increased animal activity and the animal rabies. We my money, so that you have a sense of the cost to the county in the last couple of years. I have probably more information with me than I need to, but it's identifying what I want to show you. Well, it's in there, but the busiest months are May through June, and probably it's on average in January, 10 hours a month that person has billed us for, whereas in August, 35 to 40 hours a month on average. The salary, as you can see, is about 26 something dollars an hour. This role provides information on the exposure investigations for humans. Has to give the authorization for post-exposure treatment, monitors the quarantine and confinement of pets, ascertains that the person is getting the appropriate treatments, and facilitates the submission of specimens and the information back from Wadsworth Laboratory. It's a 24/7 job. We've been extremely spoiled by having this individual with us because they take calls whenever they come through. So they have office time and office work that they need to do, but they've been available after hours to take all the calls that come in after hours. And it is a requirement that local health department provide approval for a person to start their rabies treatment. So if you were bitten by a raccoon for some reason, odds are that raccoon's rabid, but you need to go to the hospital to get that wound treated. You also need to start your rabies post-exposure treatment as soon as possible because you probably didn't capture the raccoon. So that necessitates a call from the emergency room to the health department, and that's the same across New York State, to authorize the expenditure because local health departments are required to pay for treatment. We certainly can bill for insurance, and that's done through the ERs. But if someone does not have insurance, because rabies is a 100% fatal disease, we have to make sure that we're monitoring and following that.
Can I have a motion to put HH2 on the table?
Question.
Second.
How much you spend each year roughly?
Yeah, and I'm so mad at myself.
I'm gonna second that.
This paper. Probably that role in 2023, we spent about $12,000 in that for that person, earned about that much.
How much was it?
About $12,000. Well, this is different than the role we have in the contract we have with Finger Lakes Dog Protection, which helps to capture and prepare specimens. So I want to be clear on that. This is the office-based work, the telephone work that this role does. We also have, the field work that gets done, which is part of preparing the specimens for submission, which is a hard job. We've been very fortunate, again, for 20+ years to have the same organization, the same agency being able to provide services to us that way. Now, we expect that will continue, but it's certainly possible. We may need to look elsewhere to provide those services also. We'll know more as the time unfolds.
How many cases do we average Perhaps your,
We had 85 people assessed and provided post-exposure treatment, but it was 316 investigations that had to occur. So 316 people we had to deal with. And then 85 people who needed the baby series in 2023. That's what we had.
What's the, this one also says reimbursed. What's your reimbursement rate on this? I'm sorry, I can't
Yeah,
talk.
that's, so we have a little bit of money that we get from the state, a $40,000 rabies grant. That we primarily use for the preparation of specimens. We try to do that. But some of it can be used for some of the work that this rule does. And because it's mandatory, then it's the state aid formula that we spoke about earlier.
And is this, but this isn't a position I'm asking, is this a position that it's part-time that could be absorbed by the current staff inside your office?
So we've talked about that also. It's possible, aspects of it could be. It will cost the county a lot more for after-hours work than it's costing us right now for this position.
You're gonna be overtime, is that?
Correct. On call or overtime, depending when it's done, what is done. And who does it.
I'm not opposed to this position, always I opposed to the last one. It's just the timing for me right now. Again, I'd like to see the budget moving forward. So that's where I am again, so I'll leave my comments.
Any other questions, discussion? All in favor?
Aye.
Aye. Any opposed? That passes.
So a lot of what I was going to talk about was related to some of these positions. And I think, I want to talk with you about the education that we do because it touches everywhere in the county, right? And it's not, I realize sometimes people don't see always the benefit of education and outreach efforts, but not only does it engage various different age groups, children, parents, older people. It gets us out throughout the county and there's something for everyone in the health department. And like I said, a lot of our programs that we do, while we may be having fun engaging with you, right, at a trunk or treat event or at the Sterling Seniors, where we just presented on RSV and flu and COVID shots in the middle of the month. It's an informative way to get information about programs. So it really does provide information about services that are not just health department services, although primarily it is, right? Like early intervention. But also we make referrals to other county programs and community programs, not just county sponsored programs, right? So you never know what type of engagement you might have with someone. So it's really, there's helping individuals, it's helping families, it's helping populations, but it's also providing long-term savings through prevention, which we're really makes us happy to be able to do that. We had about 18 different events that we went to in October, including trunk or treat events, and we talked about the Sterling Seniors. I put a little bit about your public health every day, right, in the program here. The other unrelated to the education side that I want to talk about, just to keep you aware, was our early intervention. The state rolled out a new software system. This is early intervention is a mandatory program that happens to be operated through health departments and pretty much in every county. It's the health departments that operate this program. It's service coordination, it's getting PTOT, speech, whatever the particular need is, engaged with a child during their earliest developmental years in order to have long-term benefits to reach goals and typical milestones. The system has, it's abysmal. What's the word that I use? And I'm not kidding when I say that. Trying to input the data. We'll call it one, we have what we call the individual family service plans. It might take 20 minutes for someone to enter all their data if the system's working right, because there's a lot of pieces to it. And it's just And that's if you know where to go within the system. It's taking 4 hours plus to do one because the system is not robust enough to take this and it's not functioning well. That's inconvenient for us, as county employees, because we're just going to stack up the paper and we're going to have to enter things eventually when this becomes available. But it's worse for the service providers, the PTs, the OTs, the speech therapists, the teachers, because they cannot, for those plans that were able to get in there, the plans have to start the whole process. If you can't get the plan in, they can't do their part. Let's say we get our plan in, they're having these same problems trying to enter their information, and service providers are quitting because it's not feasible to maintain this. We've been fortunate in our county, to my knowledge, no one has stopped serving their children at this point in time, but the state saw this. There's been tremendous, every week there's statewide calls, tremendous flashback. And so the state has now identified a means that they can pay service providers for services that are rendered. And eventually those service providers will have to get all this data in there, but they recognize that this is a system failure.
When did you start to go from the 20 minutes enter, submit, done to 4+ hours? When did the software start to fail like that?
So the old system ceased at, the stop date was September 30th. Then there was 2 weeks of nothing where you were going to do everything on paper and then enter that stuff in. October 15th started the new, they call it the EI Hub. And it's from that point to currently, it's still problematic.
And all counties are expressing,
Every single county.
all of your colleagues are expressing this problem. Okay.
Yeah. So hence the reason the state is finding an alternative way to pay the service providers, but they're also extending our ability to bill Medicaid. Because there's a 90-day turnaround time for Medicaid, and we can't do that. So it's something that is at the forefront of amongst the state's issues on the health department side that they are working on. So, keeping you aware.
Okay,
Yes.
thank you.
Thank you.
All right.
Laura, Maureen, gonna come on up. Got a few resolutions as well.
The first resolution allows the DCS to enter into a 5-year agreement with colleges and universities for social work interns and medical students. We've had great luck utilizing second-year MSW interns who then turn involved into staff. So it's a really vital part for staff recruitment. Currently, we have several open positions, so utilizing those relationships also with the MSW program also just allows us to do staff recruitment as well, so.
Well, let's move to, can we have a motion to
Does that
put
make sense?
HH10 on the table?
I'll move it.
Thank you. Any second?
I'll second.
Thank you. Question. There was a time I remember when the contract lasted for 5 years. So it's changed to just a 1 year according to this. It said the agreement will last during 2025 and 2026 calendar years. So just 2. I just wanted to clarify that maybe for your own information. Or for ours, in the event that we move from 5-year relationship to just to 2.
Utica has been a little, Utica College, or I'm sorry, it's a university now, has preferred the 1 year over the 5 years. So this is to allow a Utica University student to come who, I want to say she lives in Weedsport, so we're hoping she enjoys it and we can kind of recruit her from one of the open positions come late summer. So I know Utica has, it varies between institutions, but Utica has preferred the 1 year contract. We prefer the 5 year contract
Right.
to make everyone's life simpler.
Any other questions, discussions?
Just a question, clerical one. It says that it's entering into a 5-year contract. So is it a 5-year or a 1-year?
Title.
Yeah, the resolution.
Resolution says 5. Or,
No, it's 25 and 26 calendar year. I believe the resolution's correct.
so what's on it?
I believe the agenda, that one's a typo. And it does say, you're correct as well, Mark, on HH 10 at the top, it says 5 years.
The title is,
Title, Madam Chair, the title should be amended to reflect the body of the resolution.
You're right.
Take care.
All right.
kind of a friendly resolution.
Yeah, a friendly resolution just to correct the typo.
Thank you. And a second?
Second.
So all in favor of the amendment to HH 10? Aye. Any opposed? Okay. Any other questions, discussions? All in favor of HH 10 as amended?
Aye.
Aye. Any opposed? Abstained? Thank you. Okay. And then we have HH 11.
This allows us to receive the funding for authorizing the DCS to accept regional money from the opiate settlement fund to pass through the city of Auburn.
I'll move it.
Thank you. And a second?
Second.
Thank you. Any questions, discussion on HH 11? Okay, all in favor?
Done.
Any opposed?
Bill.
Any abstained? Okay, it passes. And HH 12.
So this allows us to enter into an agreement with the CNYDPG group. So this is a local coalition of other local director of community services. So we would be receiving the funding and dispersing the funding for this local group of director of community services.
Move it.
Thank you. A second?
I'll second again.
So I wasn't clear in the resolution at all about the actual amount of contracted funding. I've missed it, or I don't see a dollar amount here.
Exact amount of state aid, but I know that we're going to be entering it into a contract with the CNYDPG. I know they fund different programs, including the overnight and weekend Liberty Resources Mobile Crisis. They have a contract to provide transportation for youth and families to access Elmcrest Respite for youth in Syracuse. I don't have the exact.
You just don't have the amount of
No, it's several.
aid.
Yeah,
Can we move forward, Fred, with
Yes, we can.
without an exact
We had a
amount?
couple of those last month
Okay,
as well.
and it's the planning directors group
yes, yep,
funding,
yes,
Okay.
exactly.
a little bit different than the typical funding flow.
Yes.
Group, yeah.
Yes, it's a regional, they do regional initiatives.
Any other questions, discussion? All in favor of HH 12?
Aye.
Aye. Any opposed? Any abstained? It passes. Thank you.
We were able to successfully hire a new nurse practitioner to take over Dr. Spahan's caseload. She will be starting in the beginning of December. We continue to actively recruit for therapists to fill vacant positions in the clinic. And Monica did an excellent presentation, and she has gotten her 2 harm reduction grants up and rolling. So
Yeah, that's exciting.
not a nurse street in a nutshell.
That's a lot of, filling and work since the last report.
Yes.
You must have had this nurse practitioner sort of in your back pocket.
So Colleen Kerr, who's our most senior nurse practitioner, is very well connected. So yes, Colleen was able to actively recruit her. So
Wonderful.
yes, and she's very excited to kind of join our team, which is exciting. Now Colleen could recruit some therapists for us, so that would make our lives easier, but.
And we're all appreciative of the research you and Lauren had done ahead of time to show us that we could be in compliance with a nurse practitioner over the cost of an MD.
Yeah, it's been a good shift for us too.
Great. Thank you.
Thank you.
Any questions for Maureen?
Thank you.
Thank you. And Christine. I go in order of the agenda, but then
That's okay.
the resolutions aren't in that same order. So let's take a look at your resolutions. Start with HH.
Wow.
I need a while. I need to put my papers up now.
3, yeah.
Got some stuff.
All right, so HH3 is a fill of a senior clerk position in the accounting unit. A motion to put this on the floor for discussion?
I'll move it.
Thank you.
Okay.
I'll second it for discussion.
So yeah, we're seeking a fill of a senior clerk position in our accounting, DSS administrative area. This particular individual, they have a key role that involves our BICS system, which is our benefit issuance control system. Computer system that tells us who we're supposed to pay, when we're supposed to pay. There's a lot of reports that get run. There's daily reports that get run, weekly reports that get run, monthly, just a big schedule. Basically, the information that is entered into the system comes out in reports and helps us with management of those payments. So this particular individual is it's unexpected, an unexpected leave for us.
62% state aid, federal fund.
Yeah, it says 62 on this. I have a few of the resolutions that I need to note on that, the position is actually about 50% state and federal funded, so we need to amend that to reflect more accurately because it is an administrative position versus a program position.
So I'll move to amend the third whereas. This position is at least 50% state and federally funded.
I'll
A
second.
second.
I just wanted to.
Right. All in favor of that amendment?
Aye.
Aye. Any opposed? Okay.
Can I say
So,
one more thing?
yep.
We also, within that same accounting area of the department, we are down we were able and successful in filling our junior accountant. We just recently hired her. She's been involved for only not even in 2 weeks. She is learning payroll. Payroll for us is huge. You get almost 140-ish employees payroll. We have complicated payroll with overtime, on call, those kinds of things. So we don't have a lot of extra like slack to pick up this work. There is a backup that we have for when this individual is out on, a sick day or goes on vacation, but that person is very busy. And so trying to absorb that, I just want to be able to make sure I tell you that it will be very hard for us to just absorb this position.
and the recent hire in that area is, did you just say an assistant?
Junior
Junior.
accountant.
They gave their resignation. When is that effective? What's their last day?
I don't think it says on here.
Doesn't say anything I have. That's what I'm asking.
Yeah, I don't know.
Well, I didn't hear the question, Jonathan.
I asked when the individual's last day was.
I don't know. I'll have to get you that information if you want that. Me right now, you can reach out to someone, but it's not, they're not giving us that much time. I don't know the exact day.
No, you have.
Christine, I know it may sound like I'm nitpicking here. What's the difference between a senior and a regular clerk and a junior clerk?
A senior clerk and a regular clerk, I mean, I think just the nature of the job duties that are like detailed by civil service as far as like the complicatedness of the work or, what tasks they can perform. The clerk is really like the lowest level of those type of functions within the department. The senior would have a little bit more responsibility for, maybe compiling information or being more independently working.
You can't fill this with a lower level clerk.
Can't fill this with a lower level clerk. It's really an independent, it is like more of an independent function. I mean, they're pulling off reports, they're batching information through the computer. Her role in the job duties that she does match up to what the senior clerk.
Well, I understand that, but she's leaving. You can't, I'm just asking if we could fill it with a lesser paid position.
I don't know the answer to that right now.
I guess that's my issue too, is I'm, unless there was some sort of a, exorbitant amount of difference between a senior clerk and a regular clerk. I mean, there's gotta be a difference in pay, I'm assuming.
Yeah, it's not very much. I mean, I don't think that the difference between a senior clerk and a regular clerk as far as like the pay is, isn't a ton of money. A lot of our positions are very compressed. When you factor in the 50% reimbursement, it's even less than that. I think a lot of the questions around that really is like diving.
Right. I was just gonna say, without our HR director here, I don't think we would be in a position to even,
I mean, to me, I mean, if there are, this person was supervising 10 or 15 people, I understand you could give them that title of senior clerk. I just don't know if there's enough work there to elevate it to the point of you're a senior. I mean, we've been changing titles around here in the county in all these positions throughout the year, and it's just to make it look better on a resume when we go to try to hire somebody.
This particular person does have some supervisory responsibility over the person that we have that does a lot of our scanning, scans in all of our stuff to IEDR, so oversees that work, make sure that they're doing what they need to do to keep up. So there is a little bit of that supervisory responsibility. It's not a full team, of people that the senior clerk supervises, but there is some oversight in that.
And I guess to my colleagues, point, we don't have any idea where our budget is at the moment. I've seen nothing, and I'm a little hesitant at this point to support any kind of hiring until we find out where we're at with this budget. I'm not against the position. It's just bad timing, I guess. I'm sorry.
any other questions, discussion? Yeah,
I don't know
go
if
ahead.
this is the appropriate time to jump in and talk about this, but one thing that I did bring was something for you guys to just really have a kind of a visual of how the department has cut positions over the last, 5 years and going into the 2025 of the 6th year. I mean, we have not grown our department. We've actually decreased our full-time positions from 137.2, and as our proposed budget for 2025, we would be going down to 131.2. That's over that 6-year time period. Our 2024 to 2025 decrease is from 134.2 to 131.2 for full-time, and a decrease also of a part-time position. You can have these, you can take a look at those. That we have done work, we try to do our part. And, I don't think, we haven't, we can see that we haven't grown our budget over the last, or grown our number of workers over the last number of years. And I think that should count for something. We've done, a lot to try to consolidate, to try to really look at where we can be more efficient, and I think that's reflected here.
Thank you.
Give you time to take a look at this before I call. Any other questions, discussion after looking at the comparisons provided by Christine? Okay, all in favor of HH3? Aye. Any opposed?
Aye.
And Hans, your vote? Opposed?
Aye.
So this fails. Okay, moving on to HH4.
Okay, so this, HH4 is for us to accept the funding, into the department, for the rental supplement program. I think I've talked about this maybe over the last few months, and, I report out, this was money that we are receiving from the state to help with providing rent supplements to individuals and families folks with kids, folks without kids who are experiencing homelessness or are on the cusp of becoming homeless. So what this program does is there's eligibility guidelines and standards, but if someone's eligible for the program, they would be able to have a supplemented amount paid to their landlord that would really allow them to rent at normal market rate rent for a apartment that is really sized based on their family size. So you're not gonna go out and get some massive apartment, but it's gonna be sized for your situation and be able to give you a bit of a rent supplement so that you're able to get into that apartment. And then the goal of the program is for these folks that are in the program to be able to become self-sustaining and grow their income to a certain level where they can not need this program anymore and would fall off being given that rent supplement and be independently renting their permanent housing on their own. This is coming through this year for the for us for the first time, and it's something that the state has told us that they intend to continue on year after year. So we estimate that once we get families enrolled and eligible, determine eligibility, and they find apartments, which again is going to be a challenge even with a higher rent, we would be able to help approximately 20 people obtain permanent housing for the first round. When those folks fall off of the program, a new family could come on and jump in and there would be some money available to them. The length of time that it will take for a family or an individual to actually grow their own income to be able to come off is what is very kind of hard for us to know. So based on the initial pot of money, we believe that we'll be able to initially start out with 20 and then hopefully, see some success with independence, growing their own independent ability to rent and then bring on more folks.
Thank you. A motion to bring HH4 to the floor?
Move it.
Second.
Thank you.
The goal of this, I'm assuming, is to get people out of the hotel rooms, right? And hopefully reduce our homeless population as far as like what we're putting up in the hotels that we talked about earlier.
Yep, so we're going with folks that are homeless or folks that are coming in that they need to find another place to
And
live.
is there data to support that this reduces the numbers, or is just create a backfill that never just ends?
So data to support.
Well, what I'm trying to say,
Well-
that we're actually moving people and lowering our housing numbers instead of just moving people and then filling our housing numbers back up. I think that's.
Yeah, I don't know if there's data that shows that. I mean, I think this is really an initiative on the state's part. This is something that I think that they're, I've mentioned before that I think that, ultimately, what I would like to see happen is for all of for the amount that people receive in their benefit to match what they need in order to rent their place and not be able to have to stay in the hotel. This is what they've done, this is what they're pushing out instead, I think, almost. It's not gonna meet everyone's needs, certainly, and 20 is a drop in the bucket, but it's something.
Yeah, hopefully it helps reducing our local share a little.
Legislator Strong and then Legislator Daley.
Christina, I think I've spoke with you before on this and does the state say to you when they're
for a very, very long time. And that's the biggest hurdle. So we have a lot of supports and a lot of case management that are being provided to folks. We're trying to get them, medical care that they need, to take care of their emotional health, their physical health. We're trying to make sure that they take advantage of any opportunities that might be out there for them based on, like, if they're a veteran. There's a lot of like supports in that way being given. We have a lot of case management. It's finding housing.
Yeah, fine. It's a problem. I understand. I truly do. Thank you for your explanation.
Legislator Daley.
It's probably just all been covered. There's no real data on this because this is the first time the department has gotten this kind of award, correct? This supplemental.
Yeah.
And ideally, the state should increase the shelter grant from $300 and some odd dollars to something more reasonable. This is a way they're saying, try this. Here's some additional money you can supplement and see if it works.
And maybe they'll grow the amount of the award to us, and other counties too. Over the course of time, that remains to be seen. We're gonna take this.
We're gonna try to help as many people.
Yeah, we already have some folks that are targeted. Right now, we're still waiting on some paperwork from the state that they want us to use for an application and whatnot, but we already are going through our list, seeing who matches up really good to the eligibility criteria and, what the intention of the program is.
Okay. Attorney Westfall, remind me, did we move this to the floor, HH4?
Believe so.
Yes.
Okay. Any other discussion, questions on HH4? Hearing none, all in favor?
Aye.
Aye. Any opposed? Abstained? HH4 carries. HH5 is a contract agreement for interpreters.
Let me talk about it a little bit
Sure.
first. Okay. So yeah, so this would be entering into an agreement with Aurora of Central New York for interpreting services. This is something that we utilize, not real super often, but we do have folks that we work with that are blind or visually impaired or hearing impaired. And when we have folks like that we need to work with, we're obligated to provide services for interpreting if they need that. We have worked with Aurora in the past. And we'd like to continue to have the agreement to do so.
Move it, Mark.
Second.
One thing I did want to mention is I noticed in this resolution, it talks about an attachment. I think that somewhere in here that it's the terms are attached. You see that?
I do.
Yes.
Great.
Yeah.
So I brought those with me. I think that we did send them in with the resolution, but for
Yes.
some reason they didn't.
They
Does everybody have
didn't
them?
get into that.
Into the email.
Okay,
Yeah,
nobody needs them?
I'll take a look at it.
Okay.
Yes, please.
I'll have a hard copy for
We
my
can
record.
put them in the resolution because they're so,
Yeah.
there's pages of the different, anyone else want?
Thank you.
Yep.
Sounds well.
Take them. Really based on the amount of time that the individual that's providing the services working, there's also travel time. Things like that, what time of day the session happens.
Should have paid more attention in sign language class.
So what?
I should have paid more attention in sign language class. Yeah, wow. See those rates.
We moved HH5.
Yes.
Mark, my second.
Any discussion or questions on the contract? Hearing none, all in favor?
Aye.
Any opposed? Any abstentions? HH5 carries. HH6 is also a contract. This is entering into a contract with Chapel House for provision of supportive case manager.
I'll move.
Thank you. Thank you.
Yeah, I'll second.
Okay, it's on the floor. Thank you.
Okay, so, yep, this is, supportive case management through Chapel House that is provided to individuals that are housed in the hotels, motels, like we talked about, case management is provided. This is a full-time staff that they have through Chapel House that, goes to, the hotels to visit individuals that we have there, meets with them, helps with identifying what services they might need, getting them hooked up to those supports they talked about, that they might need for their health services, healthcare, for benefits programs, helps to help them make sure that they're doing what they need to do with the department coming in. And then also the concrete, housing related like searches and helping them identify landlords and where to actually look for apartments and things like that. They do kind of that whole kind of holistic, approach of, what are the barriers and go from there. So
I see, I have two questions. This is in the 2004 budget. Are we renewing a contract that's typical? Okay.
yeah, so this is in our budget for 24.
Okay, so it's a renewal. So it's really extending. Why are we renewing at the end of the year for the 2024 budget?
It's just where it kind of fell when we entered into the contract originally, and it went 1 year to 1 year. So it just happens that this one falls at this time of year.
But while it says 24, it continues through.
2025. I mean, we have it in our earmarked, for the funds that we would need in our proposed 2025 that we submitted. This contract didn't go up very much. It was 79,644 for the last 12-month period, and it would be going up to $81,632.
Okay. Any questions, discussion? All in favor of HH6?
Aye.
Aye. Any opposed? Abstentions? HH6 passes. HH7 contract for transitional housing alternative for homeless clients. This is also with Chapel House.
Yep.
Move it.
Second.
Thank you.
Okay, so yes, as you said, this is a renewal of a contract with Chapel House for the transitional housing program. So this is the Grant Avenue Shelter, Ray of Light, we call it. This is the 16 beds for emergency housing that is located on that site. As I said earlier, when I spoke, the contract is for $504,433. It has gone up 2.1% from the last contract. It was it's a $10,756 increase over the one that they're in. What it breaks down to is if it's 100% occupied, it ends up being a rate of $86.38. My math was wrong. It says here.
Oh, this says
We need to
$84.94.
amend it to be $86.38 to be accurate
Okay.
to that contract amount.
I will make a motion to amend HH7. The fourth whereas to change the amount of $84.94 to
$86.38.
and $86.38.
38.
A second?
Yeah.
Okay, thank you. That amendment,
Aye.
HH7, any opposed? That passes. Any other questions on the resolution as amended?
The good thing about this is that case management is built right in. So they have case manager through this contract that works with the folks that are at the regular shelter, who works with them. So $86.38 is less than a hotel room we're paying for. And then we have on top of hotel rooms, we have to layer on top of that other case management contracts. So a little bit less expensive.
And I note in the last resolve that this particular contract it's got those very specific dates that
Yes.
show the flow from
Yep.
24 to 25
Yep.
for our budgeting purposes. Okay. Any other discussion, questions? All in favor of HH7 as amended?
Aye.
Aye. Any opposed? Any abstentions? HH7 passes. HH8, we're done here. Getting near the finish line here. This is an authorization to fill a caseworker vacancy in the child welfare unit. Motion, I'll make a motion.
Motion to put it on.
Second.
I have a question.
Okay,
Do you have any other vacancies in this job title currently?
we do.
How many?
So currently, we have one that we have received permission to fill already that's still vacant.
Okay.
We have these two that we have,
Well, right now we're just talking about, I'm strictly speaking of the child welfare unit position for child protective. That's what I'm specifically asking about. Because there's two resolutions, one for adult protective and one for child protective. And I'm specifically right now asking about child
yeah,
protective.
so one, we do have one caseworker that we have permission to fill. That we
Okay.
haven't this.
So it's still open.
So this vacancy would be the second
We'll do the second.
in child welfare.
It, just because, is there a reason why they're not, can't find somebody, nobody's
So,
take the job?
so what's happening with our caseworkers across the board, whether you're talking about child protective, foster care services, preventive services, or adult, is we have basically a revolving door. You know, we are bringing in workers. We are sometimes struggling to bring them in, like we have vacancies for a little while. Sometimes we do have folks that come right in with fill out their application, they come in and we don't have as many, but our volume of turnover is so incredibly high. And, you know, one other thing to note is that in December, we're gonna have 2 more workers that are going to be leaving that I haven't even done a resolution for.
As far as child protective.
One of them is gonna be in adult services.
Adult services.
Um,
Yeah, but I don't want to jump ahead with that. I mean, I don't mind bundling them, but. And I will jump ahead real quick out of order, I guess. The adult, do you have an opening in adult as well? I might as well ask the same. So you have an opening
Yep.
on both of these?
Yes.
Okay.
Yep.
The reason I ask is if we didn't have openings already, I'd be, you know, I would support this and move it along. Again, I'd like to see where the budget lies, and I'm not saying these won't get filled down the road, but seeing there's already openings that are still existing, I'm gonna pass on this one tonight. And with the next one, that's running. Only based on the deal, have those openings, and I'm not saying it won't get filled down the road, but I'd like to see where we land.
Can I talk to you about my concern with that?
Please.
Sure.
So we have 25 full-time budgeted caseworker positions, and with 5 that are going to be unfilled, that's 20% of our workforce that are caseworkers that we will not have bodies in. When that happens, there's a lot of ramifications. I mean, you're talking about in child protective, that there's less workers to assign cases to. That means that there's higher caseloads, the number of reports that they're investigating goes up. The amount of time and attention they can pay to each one of those cases lessens. Their ability to beat the deadlines is difficult because they have such a high caseload. They have to see people with a frequency that we don't determine, but is determined with the state. And, you know, we have to do their own investigation, no matter what our number of cases we have is. And so you're talking about, you know, across the board, there's just so many touch points of how it impacts people. We have workers that are putting in tremendous amount of overtime to try to keep up, because they feel responsible for doing their job and doing their job well. That's the kind of the hidden, you know, burnout, you know, that I think it does have an impact on why people are leaving. You know, so that is a big concern that we have with vacancies. What ends up happening is, I know that these 2 folks are going to be leaving in December. I would like to get people in the pipeline to be trained, because our training period is so long and takes so long before they're actually able to take cases. They have to go to training, they have to master certain skills. That's a state training program. If we don't have people kind of in that pipeline and we don't fill these positions, we have 5 that are vacant. Nobody's getting ready to be able to take more cases when the next one.
Currently, you have, how many positions do you currently have vacant for these?
The 3.
For 3, how many, 1 in childcare and 2 in adult?
We have See, all of our child welfare all start out being trained in child protective services. And so we really kind of like assess our situation of where we need them the most. And we kind of pivot based on like, you know, like where we feel like we need to plug somebody in. We also have people that go out on maternity leave. We have people that go out on extended medical leave.
How long have they been vacant for?
The months, you know, for the, you know, months.
I guess my point is we have three that are open right now that have been built for months. I don't think taking a pause on these two is gonna have a dire effect for the next 3 years. You know, I understand and I respect what you're saying and the work you do, right? I really need to see this big picture that I haven't seen yet. And that's just me. I'm not speaking on behalf of anybody else.
I just, Christine, I want to be very clear. I want to follow Jonathan's point word for word, Brittany here. One of the things that I'm frustrated with is that I know here a while ago, there was a briefing, our Ms. Ferris said, you know, there was so many positions that were unfilled in the county. And I was shocked over the number, 600 and something. I asked for a breakdown of that. You know, what are these jobs? Are they, you know, and somebody said, well, some of them are a fair amount of them are part-time positions, summer help, whatever you want to call it. I get that. But I feel like, and I'm not faulting you at all. I feel like if we have critical positions, and I would say that these are critical type positions, they need attention. And if we've gotten one that is not been filled for months, maybe you have given us that, hey, this is, you know, I'm losing this person and it's gone over my head. I apologize to you for that. But I have to agree with Jonathan, until we figure out where we're at with this budget, you know, another couple of weeks, until 30 days, because obviously it won't be done until the next time you're here. But I just feel like, you know, I get it. I'm not saying that down the road I wouldn't support this position. I more than likely will, but until we get to that point,
Madam Chair?
knowing where we're at.
When you're ready, sorry.
But
Any interest in tabling these to next month, given what I've been hearing about wanting to see the budget? Because the budget is coming out in, I don't know, 10 days.
Yep.
Yeah.
I don't have.
This is just a suggestion rather than defeat it, but the suggestion.
That's up to you.
If we get Han back in the room, so we have a quorum,
That might,
or actually 3 is a quorum.
3 is a quorum.
I don't have a problem supporting tabling it until next month, or
Sunday, the early meeting.
I don't have a problem with that myself.
Just suggesting next month
I
because
have no objection to bring it back. I just wanted to see.
So,
I don't have.
Making a motion to table?
I'll make the motion to table till December's.
HHS meeting.
HHS meeting.
I'll second. All in favor?
Aye.
Aye. Any opposed?
Well, you'd have.
Abstentions?
Oh, we got.
Right, but we still have quorum. So this is tabled.
8, 9.
we need to put 9 on the agenda.
We'll have to put
Just to-
HH9 on the floor
Okay.
and move that as well.
Can you do that at this point? Are we ready?
Yes, you can do it at this point.
I'll make a motion for HH9.
And I'll second.
I should probably clarify that to table it until the next HHS.
Correct.
Any discussion that HH9 is also a fill of a caseworker, and this is in the adult protective. A motion to table?
Yep.
And a second? All in favor?
Aye.
Any opposed? That table carries.
Can I just say a couple of things?
Sure. And we could, I'd like to hear your,
I have some slides for you guys that came out of a presentation that was given at New York Public Welfare Association. And, you know, I have said every county is struggling with the same issue, you know, younger. but I've never seen slides that actually broke it down as far as the fiscal impact to the county when that happens. And I thought it was like super, like the information was like is very powerful, and it talks about each time a caseworker leaves for a recruit, it's cost the county about $54,000, and also results in longer stays in foster care and repeated maltreatment. And it talks a little bit about the reasons on that, that happens. I mean, it's just, I think it really does like kind of summarize like what we all know. That it does have an impact. It delays timeliness of investigations, like I said. It decreases the caseworker's contact with the family. It really provides insufficient time to make thorough assessments, and so it has an impact on safety and permanency for children. It decreases our service timeliness, our continuity of service, and the quality of service. It decreases the quality and continuity of relationships that the workers have with the families they work with, and so it reduces trust, self-esteem, and sense of control by the family and the youth. And it leaves less time for building the meaningful relationships with the families and the kin and the resources. It also talks about how 24% turnover rate equals a 14.9% rate of reabuse in your county. On the converse, if you have lower casework turnover, you have an increased chance of permanency. You have almost a 75% chance of permanency with one caseworker per year. You have a 17.5% chance of permanency with 2 caseworkers in a year. You have a 1% chance of permanency with more than 3 caseworkers in a year. Our families have oftentimes more than 3 caseworkers in a year.
When this slideshow, this information was presented, any solutions-based information presented along with it?
There's information about like what can be done to like help support your staff to feel like they want to be a part of your team. I can tell you, not filling positions does not make them feel confident and want to stay working for King County. They feel overwhelmed, they feel overworked, they feel undervalued, very, very undervalued by this body. That's the reality. It's very upsetting.
Thank you. I don't think we have any other business. So a motion to adjourn?
Move it, Mark.
Second? All in favor? Thank you.
Everybody's letting you get yes or not. Or, pretty sure Elaine Daly's still on the committee.
I am sorry.
All right, it's okay.
Take your time. We'll wait.
I'm gonna call this meeting to order.
Come on, Daly, get up, just because you bring candy.
This evening, we have myself, Legislator Daly, Legislator Shea, Legislator Winslow, and Stephanie. I have a motion to approve our minutes for the October 2nd, 2024 meeting.
Second.
All in favor?
Aye. Aye.
I'm gonna jump around a little bit tonight. Real quick, I'm gonna start, this is an update on Stop WI and Charles Ladouce. Not aware, I have received and the county has accepted his resignation from Stop WI coordinator effective 15. Just to make everybody aware. With that said, I'd like to bring Brittany Antonacci up first, our district attorney.
Good evening. Really quick update. We hit a record for indictments this month. We typically average around 17 indictments per month. We had 34 in October. So we are extremely busy when it comes to felony arrests. I do have two resolutions. JP3 and JP4 are very similar, so I'll discuss both of them. JP4 is just asking for authorization to accept the GIVE grant funding. Our portion of that GIVE grant is approximately $107,000. And then JP3 is related. As part of the grant, we are required to do a youth portion. And so that is going to be the Community Accountability Board. I am looking for a very part-time coordinator. It would be a $15,000 portion of that grant funding to run the Community Accountability Board, which would fulfill that youth requirement as part of the grant. I already have someone selected. He's accepted and he's ready to start in January. We would look to start that position in January.
And just to clarify or reaffirm, JP, the position as requirement of the grant is funded by the grant. So
Correct.
there's no local share.
Correct. There's no local share. It's fully covered by the state portion of that $187,000 in JP4.
I'd like to offer JP 3 and 4 as a bundle. Can I get a second?
I'll second.
All right, any discussion?
And this accountability board is not required. Other counties have it, but this does meet one of the requirements of the GIVE grant. That's why you're pursuing it.
Yes, exactly. Yes.
Any further questions? Okay, all in favor of the JP 3 and 4 as a bundle? So moved. Anything else with you? Thank you, Brittany.
Thank you all.
Let's have Lloyd come up.
Thank you. I'll be as short as Brittany got. I have two resolutions tonight, but, Mr. Chairman, I'd like maybe you to consider
JP 2.
pulling JP 2.
Yep, and stick with JP 10.
Thank you. Or pull JP 10.
Pull JP 10, I'm sorry.
Yes.
This is JP 2. Fred, we're gonna pull, they're kind of overlapping. We're
I
gonna
understand, yeah. Yeah, we're good. So you're going to pull 10 and then just proceed on JP 2.
Correct, if that's okay with the chair. This resolution, as we've been saying, Brittany's caseload is way up with all her indictments. The end result of that is that these people need to be represented. We've been, for the last couple of months, either John Price or I have been here to talk about we're soon going to run out of money. We have enough money to pay our bills in November. And those are already into the queue to be paid, and there's $65 left for December's bills. So we were able to secure two grants of $160,000 apiece. And so what this resolution will do is actually there's no local share involved. We're asking for the county to accept the appropriation of those two grants, and then we'll use that to pay the rest of 2024 legal bills.
Can I get a motion for
Move
JP
it.
2? Second. Okay. Questions?
At one point, there was thought that the Sound Council, expenses maybe like $400,000 over budget, but that didn't come out to be. It was more like 200,000, but this is going to negate that.
Yes, this will negate.
Okay, so you won't be,
It'll be closer to 300, yeah.
it'll be closer to 300,000 where we're over budget
Correct,
instead of 400 or 500?
correct, yeah.
And then the grant covers
The
that.
grant will cover
Share.
our deficit.
Oh, so okay, that's what I was trying to get at.
So
This grant will cover the
321
deficit.
will cover our $300 being
Okay.
over
And our
budget.
projected revenues for 2025, you'll see when budget's presented.
You got
Our
one.
local share actually will be lower
Yes.
next year than this year.
And you advocated for this money, Lloyd, because you knew what was happening? Or did the state just,
This particular money is through DCJS, so it's from a different funding source.
but the state recognized what was happening to the locals?
Um,
Or,
yeah, it's a supplemental.
yep,
Yep.
okay. All right. Thank you.
All right, any other questions for Lloyd? On JP2, okay, all in favor of JP2? Aye. One
Aye.
more question? Oh, aye, okay, yep.
And lastly, Mr. Chair, our move to the professional building, kudos to IT and also maintenance. We currently have internet up there. We should be, some of the filing cabinets have been already moved, thanks to maintenance. We should be in the building hopefully by the end of next week.
So anytime after next week, you're open for visitors.
Yeah, we're obviously being displaced by the new judge that was elected yesterday. So we have to make room for the new judge, and we were the department to get evicted. So we're fortunate that we have the office space that we do. It's great office space. And indigent legal services, the state is covering the cost of it. So
Thank you.
that's all I have.
All right, thank you.
Thank you.
Good evening, sir.
I don't have anything.
That's why we like you, Tyrone. That's why we like you.
Good answer. Yeah. Really, just working more busy, so, obviously with everything that Brittany has going on, we're seeing some of that pickup for us, so. Other than that, we're continuing to keep working on financials and getting that stuff, straightened out and we got, two people doing firearms right now and they're finishing up with everybody except for this guy will be fully trained.
You plan on getting more, you have a plan on more vests next year? Because you're gonna do a multi-year, is that something you?
Yeah, so we'll try to get, we were able to get 4.
Right.
And we'll need probably two to 3 next year, so if we can stay on that course, we'll be pretty solid.
Because you budgeted for them at this point, yep.
Okay. Any questions for Tyrone? Well, thanks for sticking around for us.
Thank you, sir.
All right, Tyrone, thank you.
Long,
Reese, are you still here?
I'm gonna be faster than all 3 of them. I'm so hungry.
Okay, go. Take a ride.
I have one resolution, and that's just a maintenance resolution for the UPS at the backup center. If you recall, a few months ago, we actually passed a resolution for the maintenance. This unit is end of life, but because it's not used often and we're not using the backup center, the vendor opted to give us an additional 6-month extension to try to get us through. Because at this point, it doesn't really make sense to change out that unit.
Okay, that's why it's 6 months.
That's why it's only 6 months, yeah.
I'll move that.
Get a second from someone?
Second.
All right. And I also know that we worked with Amanda's office in this bid, correct?
Yeah, Amanda did all my work. It was great.
Okay. And I think she saved us a little money too, so kudos on that. Any questions about JP1? All right, no questions on JP1, all in favor?
Aye.
All right, so moved. Any questions for
Like 80
Denise?
seconds left.
Okay, go ahead.
Just a couple, quick things. You'll see on my, report, we had staff suicide training in the month of October. Phenomenal training. We brought a trainer in from, I think he was from Texas. He trained all the staff and kind of one of the goals of that is one, to take staff through suicide calls, just get, you critique them, you go through, do's and don'ts. But another big part of training like that is mental health training for staff to help them recover when they take calls like that. And since that time, we've had 9 suicide attempts since they've had that training. So that just gives you, I see Monica talked a lot about the mental health and those calls can be draining on staff. So it's good to do the training. We did an emotional intelligence training for supervisors. The goal of that is leadership, conflict resolution. And one of the key components of that is empathy, and not only learning about yourself, but also learning about your staff and knowing the triggers. And that kind of helps them with conflict in the center and mitigating things before they become a bigger problem. So I just wanted to kind of highlight that stuff. Oh, let's see, staff updates. We have a vacancy, a dispatch vacancy and a supervisor vacancy right now. And as far as the backup center, the internal laptops that we talked about last month are now functioning.
Okay, good.
Yeah, so our IT department worked with our vendor last week. We kind of forced them to come on site. And then Monday, they finally got the connectivity working. They're at Owasco right now. And so we will, every couple of weeks, we'll go over and test those to make sure everything's functioning properly. And I did give the county administrator a full report of, kind of where we're at, needs, assessment. And so if anybody wants a copy of that, then I'm happy to share it.
You mean the operations manager or?
No, it went to the county manager.
Oh,
Went to
Steve,
Steve,
I'm
yeah.
sorry. Fine.
It actually went to both of them.
Yeah, if you could send that to me.
Sure.
Any questions for Denise, anybody? You're just a little longer.
Sorry. I'm sorry.
And I have some resolutions.
Oh, Riley's in the back. I see Riley in the back. I'm sorry. Yeah, I'm looking for, I didn't see it back there. I'm
Just put his
sorry.
tissue away.
You're hiding behind Sharumi then.
Good evening. I submitted my report. The only thing I just wanted to, and I don't want to spend, I was hoping not to spend a lot of time tonight because it's getting late and I can bring this after the first of the year, but working with the local SPCA, since they've lost their animal cruelty officer, we'd like to explore adopting an animal abuse registry in our county. There's a number of counties throughout the state who have adopted a local law to establish an abuse registry. I would like to pursue that. We work with the county attorney to do that, but my thought was to wait till after the first of the year when we get beyond the budget and some of the other things we have going on. But I just want to put it on your radar. I would like to pursue that, and I'm hoping that you'll support that. I don't think there'll be any cost to manage that, but I don't know if you want to talk.
From your point of view, the abuse registry is because we'll know what animals might be, or there's other connections around abuse that in terms of.
So basically, it would be a registry, a local registry that we would maintain at the sheriff's office on a website that would be accessible to the public. If somebody's convicted of a crime involving animal cruelty, their information would go up on the site. So the SPCA or any local individual that's selling an animal or looking to adopt an animal or even beyond our borders or trying to do it, their information would be there. So it would be public that they had abused an animal in the past. But I do want to pursue that. I'll bring that forward after the first of the year. I don't have anything else, unless you have any questions, just my resolutions.
All right. 5 resolutions. I'm gonna bundle a few of them together. I'm gonna bundle 5 and 6, which authorizes the chair and the sheriff to accept the grant from the domestic terrorism program, and 6 authorizes the chair and the sheriff to accept the grant funding from New York State's Governor's Traffic Safety Committee. Can I get a motion on bundle?
I'll move JP 5 and 6.
Second.
All right, any questions for the sheriff on JP 5 and 6? With all in favor of JP 5 and 6?
Aye.
Aye. So moved. JP7 involves food service for the jail. Can I get a motion for JP7?
Second?
Any questions for the sheriff on JP7 or any discussion? All in favor of JP7? Then we have JP8, and that's a resolution authorizing the sheriff and the Auburn Police Department to enter into an MOU of mutual aid to New York State General Municipal Law. I'm going to ask the sheriff, let's put it on the table. Can I get a motion for 8?
I'll move it.
Get a second?
No second.
All right, let's have discussion. Sheriff, can you explain JP8?
Sure. Just to renew an agreement that we've had longstanding with the Auburn Police Department that outlines the parameters. Whenever either agency needs to request the other agency for mutual aid, it outlines the parameters as far as how that will be accomplished and who will be responsible for certain things relative to that mutual aid response. But this is something that we've had for many years, and we're just renewing an agreement that expired. The City of Auburn Council did approve this already at their end. I'm just looking for approval at ours so that we can sign that, enter into it.
All right. Any questions or discussion? All in favor?
Aye.
So, and the last one is JP. JP9. There it is. JP9 authorizes budget transfer to the county sheriff's office. This requires a 2/3 vote at the full ledge meeting, correct? Yep. So I'll have a motion to put it on the table.
I'll move it.
Thank you. Sheriff, you want to talk about JP9?
Sure. JP9 is looking to amend our budget. It looks like we're anticipating needing an additional $175,000 to cover prescription costs within the jail. Basically, they're mandated costs that we have. A portion of that, I don't have an exact dollar, but so far included in our overall costs for prescriptions is just over $100,000 so far in medication assisted treatment drugs, MAT drugs, that we're mandated to provide. We do have some funding that comes to us through mental health, opioid funding, and some additional funding from OASIS to offset the cost of our MAT program. So some of that revenue will offset some of these costs. However, the way that it's budgeted, it isn't put into a revenue line that automatically removes those MAT drugs from our budget. Our MAT drugs are mixed in the cost with the other drugs that we purchase for the population. So that specific revenue that will go to just MAT drugs. However, the additional 175 is to cover all of the prescription costs, including MAT and everything else that we have to provide.
I had a question that came to me and I didn't know the answer. I thought I knew the answer, so I answered it. I told him I would ask. The question that came to me was the prescription costs. These are just for our county housed inmates. Any prescriptions that come in for inmates that we're housing it, for federal and state, outside agencies, federal or other counties, they reimburse us for those medications, correct? That was my understanding.
Right. So the federal inmates, those costs are billed directly to the feds.
Mm-hmm.
Any local incarcerated individuals that we have, we would bill those counties for those costs.
Okay.
So they would come out with us.
So the MAT money, the 100,000 or whatever it was, that's already in your budget in a revenue line somewhere. That's why you can't add an expense and a revenue. So it's already in there. That line itself is just going over.
Correct. We have a $90,000 revenue line from OASIS, and we also have an additional $150,000 for additional opioid funding coming through mental health.
Yeah.
But that's to cover med costs, prescriptions, an LPN that we had to add because of this program. And then we're trying to bill any peer support that we can bill towards this program. And we're also trying to look at any costs for staff that have to drive to go pick up medications, the methadone, whether it be at Farnham here in Auburn or at Krause in Syracuse. We're going to try to bill their time and travel time to pick those meds up back to this. So we can utilize as much of that revenue as possible.
Going to maximize that revenue, but you don't have the LPN now, or it's.
We did, we had one leave. We currently, we just offered the position to a candidate who I believe is going to accept it. So we'll have somebody back. But for quite a few months this year, we've been unable to bill any cost because we haven't had anybody in that position.
Yeah.
So that revenue will offset, we'll have enough revenue in those lines to offset the actual MAT prescription costs.
Any other questions? Any other legislators?
Yeah, I just have a question. So you're saying you're gonna have revenue to cover this cost coming in, or are you saying that?
Not all of it. We will have enough revenue to cover our MAT costs for those prescriptions. There will be some prescription costs above and beyond our budgeted amount. Forget MAT, above and beyond our budgeted amount. It could be over our budgeted budget amount of $325,000 that we plugged into our budget for 2024.
So just thinking about this, for the end of the year 2024, you're looking for 175 to cover.
Getting through the end.
Get you through the end.
Through the end of the year.
By the time we sign sign this over, after the full ledge meeting, I'm just saying it's like a few weeks, you're gonna have coverage, right? So I'm just wondering, is that 175 too much I'm just wondering what you might actually use. Like, I'm just trying to think about that because it's so late in the year.
It's hard to say because we really have 2 months worth of prescription costs and we don't know what we're going to have. And one of the challenges, I've looked at this quite a few different times, but some of these prescription costs could be very significant depending on, the medical condition of the individual that needs the prescription. We had one script in February that was $20,000 in and of itself. So it's really hard to budget in this line because we can have just a few inmates that drive our costs up so significantly that we go way beyond our budget just because of 3 or 4 inmates. So we don't know what we're going to have the next 2 months, but I think that that's going to be enough to cover it. And if you subtract the revenue and the MAT costs from where we think we're going to be with total prescription costs at the end of the year, I anticipate we'll probably be about $75,000 over budget. But we have to ask for 175 just due to the way this is budgeted. The way the revenue line's budgeted.
It's up to Dr. Duckett to order these drugs once an inmate comes in. So I'm sure he's looking at these particular drug costs and looking at other formulas that.
He is. He's definitely looking out for our best interest and trying to make sure if there's anything we can do to avoid having to provide that prescription that we do that. But we have to meet the community standard of care, and he has to make sure that we're doing that.
No other mandated costs. If you go over, you have to be made.
Mm-hmm.
If you give him the 175, he doesn't spend it all. That just goes back to the general fund, correct? At the end of the
My understanding, if his questions, if you didn't need the full 175 in the end, it would come back.
It would just be in that line when the budget's at the end of the year, and it would just go back into
the general fund.
But that to our best, that's our best guess as to where we're going to be at the end of December. It's hard to say with any medical costs or prescription costs.
Any other questions? Anybody else? Okay, no other questions. All in favor of JP9? Aye. No opposed? So moved. Okay. Any other questions for the sheriff? I just want to say thank you to the sheriff for coming out up and Saturday and didn't get a huge turnout, but I appreciate your time and helping those that did. So.
Thanks for partnering. Thank you.
You're welcome.
Highlight of the Eagles.
Well, everybody eats my pets.
Good something, good something.
Good something.
Get your coffee first.
Good evening.
Evening, everyone.
Thanks for bringing all the trucks.
Absolutely.
I thought we were going to need a rescue one ourselves for a while.
That's what we're here for. I do want to extend my thanks back to the body and the members of the committee who came out and checked out our new assets that have hit the road. It was great to have that put on, and I'm pleased to tell you all that we're about $9,000 under budget on the rescue, so that'll be returned back to the coffers. So that'll be available as well.
ARPA funds too,
Yep.
correct?
And so we were on
9 million?
9,000. If I had 9 million, I'd have a building with that, but, no, we were 9,000 under.
We found a money truck.
Briefly, before we jump into the two resolutions that we have tonight, I just wanted to touch on the fact that we've got our countywide mutual aid plan is still sitting with OFP&C or State Fire. That's a 5th-year revision, so we're waiting on that to come back. It will go out to all of the authorities having jurisdiction, be it fire districts, fire companies, or departments, before it is signed off then by our fire advisory board and brought to the center for ratification. So that's in process as well. And then we will be pursuing, hopefully upon grant acceptance, a revision of our hazard mitigation plan. That's another heavy plan that we're required by the state to have and update every 5 years. But with that, I couldn't keep up with Lloyd. The only two resolutions I have this evening are to accept funds from dishes. JP, I believe it's 11, is the emergency management performance grant.
I'd like to actually bundle JP 11 and JP 12. If I can get a motion for a bundle.
I'm moving. Second.
All right. If you'd like to talk about 11 and 12, Riley, feel free.
Sure. The emergency management performance grant is funding from the state that's available on an annual basis. In the last decade or so, that has been used to offset roughly half of the director's salary, provided certain trainings are made throughout the year. And so that's EMPG. SHSP is based off of 6 national priority areas, including terrorism response, cybersecurity, and hazardous materials response. Roughly 30% of this has to go to the sheriff's office for personal protective equipment, with the remainder then split up between our hazardous materials teams, special operations teams, and other divisions within the office. Collectively, it's about $163,000.
And as we discussed, I think the sheriff line there, that can be used for equipment.
Yep, the sheriff's is used typically for body armor, to keep up with state requirements and manufacturer recommendations.
Any questions for Riley regarding JP 11 or 12?
These are annual, right?
Yep.
Yep.
All right, no questions, all in favor?
Aye.
All right, so moved. Any other questions for Riley? Thank you again. Motion to adjourn.
Move it.
Okay.
With that.
I will follow up with you related